2022 Aberdeen IJB. We've confirmed that we are quorate. Emma, do we have apologies to note for today's meeting?
Yes, we have apologies from Stephen Close.
Thank you. Colleagues, you'll see that alongside the pack today, we've also sent out a list of people with their roles on the IJB, just really to help with new members knowing who's who around the table, and also for transparency around that. When you want to make a comment today, or when you first make a comment today, I'd ask that you introduce yourself so we're clear on who's who in the meeting this morning. You'll see that this meeting will run till 12:30, and then we'll have a 30 minutes break and reconvene for an IJB seminar at around 1 o'clock. And I'm also seeing there's an apologies from Angela Scott as well, Emma, for noting. I'll aim to build in a short comfort break around 11:15. So Emma, if you can just remind me when we get to that time, and we'll have a short comfort break then as well. We've got a lot of business to consider this morning over the next 2.5 hours, so I'd ask that you ensure that any questions you're asking are relevant to the recommendations in the reports that we're considering today, just to make sure that we give due attention to all topics. So I'll start, I should say, by introducing myself as Luann Grijon. I'm Chair of Aberdeen IJB and I'm a non-exec board member at NHS Grampian. By way of introductory remarks, I'll keep this quite short today. I want to acknowledge it's been a particularly busy time for colleagues across health and social care services in the city, as we see our residents' needs becoming increasingly complex. I want to take this opportunity to put on record my thanks on behalf of the IJB to all the staff who are working incredibly hard at the moment to meet the needs of our most vulnerable people in our city. I'm hearing of anecdotes of staff across the partnership offering innovative solutions to help meet demand, and staff participating in tests of change as we seek to put our services on a sustainable footing. And it's really encouraging to hear that some of these tests of change are already showing promising results. The environment is certainly a demanding one, and we will hear through the papers today on the surge plan, the draft carers strategy, and the plans for supporting people with complex needs, just some of the ways that Aberdeen Health and Social Care Partnership is planning to meet demand in the short term, but also in the longer term, aiming to create a much more sustainable system for the future. So thanks to all our frontline teams who are out there working hard at the moment, and also to all those involved in the transformation of services. You are all seen, you are appreciated, and you are valued. And now on to business. Today, can I ask if we have any declarations of interest or transparency statements relating to items on the agenda today? Just give people a moment if there's any hands. Not seen any hands up. Oh yeah, got one. Alison Murray.
I don't know, it's quite an obvious conflict of interest. I'm a carer, and when it comes to the carer strategy, I'm a carer. So, but I think as I'm here as a carer rep, I need to stay in for that.
Thank you, Alison. I think it's critical as our carer rep that you're absolutely around that item on the agenda. So we'll note that as a transparency statement. Thank you, Alison. Not seen any other hands up on that. Okay. Do we have determination of exempt business? Just to confirm, there are no items which require to be taken in private today. Emma, we're still content that's the case?
Yes, Chair, that's correct.
Okay, thank you. So before we get into our items on the agenda, as we always do, I'd ask that we all put on our IJB goggles for this meeting, forget other roles and responsibilities out with here, and focus on how we are making the best decisions here for the people of Aberdeen. And as we always do, to help ground ourselves, we'll now show a short film. This short film is shining a light on drug deaths and is a stark reminder, I feel, of the people and the families that are behind the statistics that we hear about. The film is available on the Community Planning Aberdeen website along with other resources, so please share widely if that would be of use to you and through your networks. So Emma, I'm going to hand over to you to get the film up on our screen. Thank you.
When heroin took my dad. When heroin took my dad, I cleaned up the mess left in the house. Floorboards, door frames, the 14 trophies from his days of ice hockey. And I replayed in my head everything that was done and said. It was always us and them. I said dad, and they said just one more broken man. I said help. I'd seen a belt around his arm after school one day. They said someone will take you away if they find out he's a junkie. I said I think it's getting worse, and maybe one day soon. The hospital beds are full, they said, of birthing mothers wailing, the old are frail. And I asked, what's the point in keeping warm our young and old if the lives in between are left in the cold? And they said there comes a day where men in this country deserve the blame for their own pain. He should have taken responsibility. He should have kept up the ice hockey. I said I could see the illness tearing him down. I said I see it in his eyes. You wouldn't see it on a brain scan. It hides behind the man. You can't fight it or bear it. You can't tear it down to a statistic. And if you stepped into his shoes, you'd lose your footing too. They said there's 100 other pairs of shoes for him to choose from. And my voice was dying, but I raised it to say, he doesn't have the choice. He's a poet and the world will never know it. He's a superhero with a fear of flying. He's in pain with a fear of crying. A runner without a field. He's a sculptor with no clay to wield. He's a fighter without a ring. A singer singing with the acoustics of a prison. He loves me and I love him. And they said, it's a tough one. I whispered, I think we're going to lose him soon. To an empty room. They'd stopped answering. I was too late to find the fix for my broken man. And I wonder how many other kids in Britain are left to clean up the mess of helplessness. Floorboards, door frames, and the 14 trophies from his days of ice hockey. I replayed in my head everything that was done and said. It was always us and them. But it's just us in the end.
Well, it's a very hard-hitting video and just a reminder of the IJB being here for everyone in the city. And we often talk about the surge and the flow for our care pathways for older people, but we are here for everyone in Aberdeen, and I think that highlights the vital work that our ADP are doing through our services and through all the arrangements we have. Okay, thank you. We'll now move on then to the standing items. The first item 4.2 is minute of board meeting of 30th of August, which is starting at page 5 of the pack. Are colleagues content with that as an accurate record of the meeting? Alison Murray, our carer rep, do you want to come in on this?
Hi, yes. I noticed this morning we got a response to my question about waiting times for camps. I was quite actually sort of affected by that because it's so different from our own experience to say a 6-week wait followed by a 20-week wait. We're in the process of a 22-year wait for therapy. I wondered if what our response was in the last half hour. I put out a query to our group, how that LinkedIn tallied with other experience, asking for experiences in the last year. And I got 3 responses in the last half hour who were all seen in spring and were all told that for a choice appointment, and all told that it would be a year wait for a partnership appointment, and all 3 are still waiting. So to say there's a 20-week wait when people are waiting and currently have been waiting for far more than that, I think is a bit not correct. So yeah, it was the response we got this morning to that. It just doesn't tally with our experience. Thank you.
Okay, thanks, Alison. I'm wondering if the experience from Alison's group could be picked up specifically with services. I think the data that we get is based on all the referrals and all the different people coming through. So I wonder if there's variation depending on I don't know the nature of that, but there does sound like there's something specific that's not chiming with your experience and your group's experience. Sandra, I'm wondering if there could be, Sandra, you just put your hand up. Is there a connect there for Alison and her group, maybe to connect with relevant folk within CAMHS?
We'll be able to pick that up offline, Alison, and we'll be able to pick up offline, Luann. I think given that we've responded back and I had seen the FOI request, so we'll do that and compare to the minutes. So we'll pick that up and get a conversation to be had.
Thank you.
Thanks, Alison. Thanks, Sandra. I'm not seeing other hands up for, we're content with that as an accurate record of the minute, first of all, and then do we have any other matters arising that either are not on the agenda or not being picked up elsewhere? Okay, I'm not seeing other hands up. Oh, John Tomlinson.
Yeah, thank you. I just wondered on page 10, item 14 talks about the annual performance report going to the City Council and NHS Grampian Board. Is that something in process to happen, or has that already happened?
Alison MacLeod. Alison, sorry, I'm already forgetting. John, I'm trying to introduce people. Yes.
Yeah, John Tomlinson. I'm a non-exec from NHS Grampian. Sorry.
Thanks, John. Alison, could you introduce yourself and your role, please? Thank you.
Thanks, Luann. Yes, Alison MacLeod, I'm lead for strategy and transformation with the partnership. And the annual performance report hasn't gone through those governance routes yet, but we're in the process of organising that, so we'll get that done.
Thank you.
Thanks, Alison. Okay, I'm not seeing any other hands up, so I'm going to move on to 4.3, which is the minute of the Risk Audit and Performance Committee. There was nothing that I saw that was being escalated, John, so will I just open that up for any comments or questions or anything you want to bring up? Yeah. People content just to note that as the minute for RAP? Yeah, okay, thank you. And then on to 4.4, which is the business planner. Fraser, I'll bring you in for this one. Fraser, do you want to introduce yourself and your role, please? Thank you.
Thanks, Luann. Yeah, Fraser Bell, Interim Chief Operating Officer at the partnership. A couple of items on the business planner today that have been deferred just for the reasons set out in the business planner, just on lines 18 and 19. And if you like, Luann, I can just kind of touch on the seminars and workshops planner as well, which just sits below the business planner, just to say that we're constantly keeping that up to date alongside the board business planner, and you'll see that the next scheduled date for a seminar after today is the 7th of November.
Thank you, Fraser. Does anyone have any questions, or are we content to note the business planner and the seminar and workshops planner? Yeah, I'm seeing folk nodding. Okay, content to note that then and the changes contained in there. So 4.6, we now have Chief Officer's report. And Sandra is with us today as our Chief Officer. Sandra, do you want to introduce your report?
Thanks very much, Luann, and I'm Sandra MacLeod, Chief Officer for the Health and Social Care Partnership. So good morning, everyone. So while we continue to face challenges and meet them head on, we are able to do so because of the first-rate skills and second to none commitment of our staff. And I'd just like to put on record that I'm so proud of each and every one of the members of our Health and Social Care Partnership team. The report is before you. I would just like to highlight a key point. So staff wellbeing is essential for the partnership to meet the day-to-day challenges and transformational change of the effective delivery of our health and social care objectives for the people of Aberdeen. And that's why we've seen the distribution of winter safety items for staff, more free complementary therapies being provided, sandwiches and light refreshments being distributed, and the proportion of mindfulness and listening services, and also a focus on our IMATR action plans, which bring forward those things that our staff have identified as important. Maintaining adequate capacity within primary care to meet the demand on practice continues to be challenging, and a number of work streams are being led by the primary care team to address the immediate challenges. Work is ongoing to enable all the Ukrainians who are staying within their welcome hubs to register with GP practices, and recruitment is ongoing to support the new health assessment team. From January 2023 and for 14 months, we're looking to make a direct award to Castleville Housing Association for the housing support to tenants in their sheltered complexes, and this will allow for engagement and assessment around new and future models of care. The first of our analogue to digital telecare programme project board meeting was held last month, and that's an important milestone for us for that programme. The culture subgroup continues to meet and is having a positive impact, with particular highlights on our boom boards, the best out of me, and those have been a great way to learn about individuals and both SLT and IJB members. Meanwhile, our SLT and ACC legal advisors have been working away on updating our integration scheme, and the revised scheme should be submitted through our routes through December 22 before it's submitted to Scottish Government in 23. To deal with the increasing demand in our acute settings, we need to create urgent capacity in the system, and we need additional emergency discharge beds in the community to ensure continued maximisation of patient flow through in winter. As we head into winter, that's been done. We also have the opening of Woodlands Care Home, a new 81-bedded care home, and we have the opportunity to increase our bed base within Aberdeen by potentially up to 43 beds, and a new innovative solution whereby we're looking to trial a GP-led unit, which will be the first in Aberdeen City. Two significant regional updates we have are the North East Alliance, North East Regional Alliance, and the NHSG Population Health Committee. The newly established North East Alliance sees Aberdeen, Aberdeenshire and Moray councils, the three health and social care partnerships, Police Scotland and the Scottish Fire and Rescue Service coming together to develop and deliver a shared vision for health and social care benefit for everyone in our communities across the region. And we also have a clear focus on population health through promoting preventive approaches and reducing health inequalities through NHS Grampian has established a Population Health Committee, which we will all be present in. Nationally, Scottish Parliament has continued to review all the consultation responses for the National Care Service, and our bid and the link to that is in the paper. The current state of national demand has also seen a number of meetings being held, including Capra Secretary, in order to discuss and confirm the improvement plans and trajectories that we have to help support the performance across the whole system. I'm happy to take any questions. Thank you, Lauren.
Thanks, Sandra. A lot in that report. I'll just give people a moment to see if there's any comments or questions from folk. John Tomlinson first.
Yeah, thank you, and thank you, Sandra and Kay. That was a really good overview report. So I really appreciated being able to read through that. On the primary care, do we understand the increase? Be interesting to know the data that we have around that, but more particularly, is this going to be a sustained increase, or is it a kind of backlog increase and it might go down, or are we still waiting to work that one out? Just a little bit more on that would be good. Thank you.
Thanks, John. Through yourself, Luann, I can bring in some of my colleagues just to help support that wider answer. So I've got Caroline Howarth and Emma Mabel wants to supplement an answer.
Morning, everyone. I'm Caroline Howarth. I am Clinical Director for the Health and Social Care Partnership. It's a really interesting question, and it will form part of our sustainability report that is coming shortly to the Clinical Care Governance group. So we've got some information in terms of the increased number of patients in the city. And it's, I guess it's more anecdote from practices who are feeling like the volume of work that's coming in, so the number of appointments and the time to next available appointment is increasing. Quite often practices measure it on the number of sort of duty doctor slots, because once your system is full, you then default to the duty doctor system, and you can tell by the number of patients that are on that list, and when it becomes bigger and bigger and bigger, that's kind of like where the supply or the demand is outstripping supply. But we hope to get you a bit more detail on that with the sustainability report that's coming in due course. Some of it is backlog, absolutely right. There's a bit of health debt coming out of COVID. I think, again, it's more anecdote. It feels a bit more than that at the moment. But yeah, we'll get you some more information.
Thank you, Caroline.
Thanks, John. Really important question there. Martin Gregg, do you want to introduce yourself, Martin, please?
Yep. Hello, I'm Martin Gregg. I'm a member of Aberdeen City Council and a member of the IJB. Yeah, many thanks for this report. I wondered if it was possible to have a little more information on the Population Health Committee. I mean, that seems to offer quite an important productive role in decision making. So will this committee process data on healthcare needs? Will it analyse and evaluate population needs? Because there's mention there of prevention and tackling inequalities. So I'm just wondering how that important, more preventative agenda is going to be addressed through this committee. I mean, I think that the evidence-based approach is absolutely essential. But just a little more information on how it's going to function, so that we can appreciate what benefits it's going to bring. I think that would be useful.
Thank you, Martin. John, I wonder if I can invite you in, John Tomlinson, as chair of the Population Health Committee for NHS Grampian, just to give a flavour of the focus in the first year, John.
Okay, yeah, I'm happy to do that, Luann. The committee meets for the first time next month in November, and it links to the NHS Grampian strategy, which is trying to balance its traditional focus on ill health and now balance that with a more focus on improving health, so population health. And so the committee's been put into the structure to try and help get that balance. Its first 12 to 18 months is going to be a period of establishing what it needs to do. So it's a committee of NHS Grampian, but clearly, just as you are saying there, Martin, the issues are system-wide, and in fact, even wider, the determinants of ill health and inequality. So your question about how it will function, we will set it up, and we've got a couple of the councillor NHS Grampian nominated people on it. So I know that Ian Yule is on it from the city. And what we will do is we will have a conversation with the chief officers, Sandra and her other colleagues, as to how we can link with the IJBs. What we didn't want to do was preempt that, and there needs to be a conversation. I think in Sandra's report, you mentioned there about the formal and informal relationships. So that's, for want of a better expression, up for grabs as we discuss that, to see how we can take it forward. And definitely evidence-based, evidence-informed will be at the heart of it. Hope that helps.
Yeah, that really does help. Thank you, because I mean, I very strongly believe in investing in the social prescribing aspect of patient care. I think when you shift the focus to prevention in terms of offering opportunities for physical activity and so forth, rather than other traditional methods, shall we say, I think that kind of innovative approach will bring significant improvements. So hopefully there will be some attention given to that kind of preventative agenda. I very much hope so. But also you would need to have in place a system of performance monitoring and making sure that any investment is going to be robustly tested and demonstrated. So that's helpful.
Okay, just very quickly, Luann, yes, prevention is at the heart of it, and the four pillars approach, which is mentioned under the North East Alliance on prevention, sits in there under, that's a King's Fund approach. Also, Public Health Scotland have 3 definitions of prevention, so that will be right at the heart of it as well.
Thank you very much. Could I just make one final comment on the response to the National Care Service to the Scottish Parliament process on the National Care Service consultation? That was exceedingly helpful. That was very full, detailed, and raised absolutely the correct and very targeted concerns and questions on our behalf. Issues such as finance issues, and that decision around adult and children care around the Daniel's review ongoing. So yeah, thank you for that really full response. It's been it's really helpful, very thorough. That's all. Thank you.
Thanks, Martin. I'm sure Fraser and colleagues will appreciate that feedback. There's a big task there. Jenny, did you want to come in and to answer that earlier question, or is it on a different point, Jenny, as our nurse advisor?
It's a different point,
Okay.
Chair.
I'll take an order then. I'll go to John Cook next. John, in you come.
Thanks,
John, if you could introduce yourself. Sorry.
Oh, sorry, yes.
Yeah.
You said that at the outset, Loanne, and I think all of us have forgotten to do it. Yeah, Councillor John Cook, one of the councillors at Aberdeen City Council and Vice Chair of the IJB. Thanks to Sandra and to Kay. I always find the CEO's report really informative and helpful. So thank you for that. A couple of quick comments and a question. Really good to see that staff wellbeing was kind of like the #1 item, particularly in light of Luann's comments at the start and in light of the recruitment difficulties we're having. So that's good. On the stuff around primary care on page 28 of the pack, I think it's good that we're doing something to enhance public awareness of changing roles in primary care, because you sometimes hear people saying, I couldn't see my GP, I only saw the advanced nurse practitioner or the physio, and they've got this kind of Dr. Finlay model in their head of what primary care should look like, whereas in fact quite often seeing one of the other professions allied to medicine is actually much more appropriate for the patient. So I think explaining that I think is really important, and it's quite good. So I'll finally get to my question. Again, on page 28, there's a comment in relation to boundary changes for GP practices. Am I correct in thinking that if there are any boundary changes, that would not mean that any existing patients would have to change practice? Because I think that's something that people would want to know about.
Thanks, John. I see Emma King's put her hand up. Emma, do you want to answer John's question on boundaries for GP practices? Do you want to introduce yourself first, Emma? Thank you.
Yes, thank you. I'm Emma King. I'm the primary care lead for Aberdeen City. So yes, John, your assumptions are correct indeed. So when there is a boundary change, it doesn't mean that any patients have to move practice at all. It's only for new patients moving forward.
Thanks, that's really helpful.
Thanks, John. Jenny, if you can come in now and introduce yourself as well. Thank you.
Thank you. I'm Jenny Gibb. I'm the professional nurse advisor on the IJB. Thanks for the report. I was interested in the Woodland Care Home update and the increased bed base, which of course will be really welcome into our wider system. I guess I was just really interested in what the staffing model was going to be for that, and if there were any challenge at this point around how we were going to meet that. Thank you.
Thanks, Jenny. Sandra, do you want to come in on that one, or I see Shona's hands up? Shona, do you want to come in?
Yes, good morning. I'm Shona Oman-Smith. I'm the commissioning lead for the partnership. So Jenny, thanks for your question. We're working really closely with Woodlands, and it's a very staged approach to admissions that we're working with them. Woodlands is a part of a really established care provider, Belsize, which is part of a larger organisation, Care Concern. They're well versed in recruitment, and they have got a robust recruitment process undergoing at the moment, which is working really well. We've got a meeting with them this week to further detail how that's progressing. We're not actually at the stage of admitting yet. That's hopefully going to be the 17th of October, and so we'll get a really good handle on what that's looking like. They've recruited a lead person to manage all the beds that we're contracting, but we will keep IJB up to date, and there's another paper coming next, IJB, about Woodlands specifically. But if you've got any further queries, let me know.
Thanks for that response, Shona. That's really helpful. Last question on the Chief Officer's report from Christian.
Thank you very much, Luan. Christian Allard, elected councillor for Tory and Fenhill. It's regarding the very good work that all the team is doing, and particularly to support refugees, is on page 29, 3 of the report. It's how doing recruitment to support the new health assessment team. I read there is 1 service manager, 2 team leaders, and 5 care navigators. I just want to have an update on how, if there is an update, first of all, on this possible recruitment, and how confident are we to fill those 8 posts in these very, very difficult circumstances.
Thank you, Christian. A good question there. Sandra, I don't know if there's someone specifically from your team who could answer that question today.
Yeah, I think I'll probably bring Emma in. I think in the Pacific, Emma, you'll be able to answer where we are with recruitment for those 8 posts and the impact that we're expecting those navigator posts and the key, the impact that will be to help people coming to live in Aberdeen. I think that's the summary.
Thank you for that summary. Hi, so it's Emma King, Primary Care Lead for Aberdeen City. So we've been very fortuitous in this situation, actually, which is unique, and we've been able to over-recruit to some of those roles. We had successful candidates from lots of areas, lots from Test and Trace team that were with us before. So we've got several success stories in terms of being able to recruit from those people that have lost their roles, but also people that have been volunteering to work with the refugees and that have been really successful and in implementing the service. So we've over-recruited by 3 whole-time equivalents currently. So we don't anticipate with any issues with that moving forward. We've got the interviews for the service manager tomorrow. So we've had applications for the service lead as well. So it's actually going quite well. Christian, does that put your mind at rest, or was there any other detail you needed?
No, that's fantastic news, and it's great that we can draw from the third sector, who's been fantastic as well, but all your team helping refugees. That's great. Fantastic to hear. I'm sure a lot of other services will be very jealous of your success.
Yes, it's very rare I get to be the bearer of such good news.
Thank you, Emma. Thanks for that question, Christian. Fantastic news, and I'm sure there's the 3 that you've over-recruited. There'll be no shortage of other opportunities for them as well, so fantastic. Okay, so thank you, Sandra, for your report. Very comprehensive and a really helpful overview of all that's happening, or a lot of what's happening in the partnership. So we'll note that report, and then we'll move on to 5.1, which is the meeting dates for 23-24. Emma, I'll let you introduce this, and if you could introduce yourself as well, Emma. Thank you.
Thank you, Chair. I'm Emma Robertson. I am clerk to IJB. I work in committee services for Aberdeen City Council. So my report is on the meeting dates for next year. The board is required to agree an annual meeting schedule prior to the new financial year, and the proposed dates are outlined on page 36 at item 3.6. I'd also like to ask members to note that on page 37 at 3.12, a short survey will be sent to members to gauge their interest for attending at hybrid meetings. Thank you.
Thanks, Emma, for that. Hopefully quite straightforward. The recommendations are that we review and approve the meeting schedule and note the update regarding the meeting format, which is really that next year we're considering hybrid opportunities, but there'll be a questionnaire going out to people first to gauge interest in-person meetings. So if people are content, or if there isn't any questions on that, are we happy to agree those recommendations which are on page 35 of the pack? Yeah, good, okay, thank you. So now moving on to the additional circulation for today, which was the audited final accounts for 21-22. I'm going to hand over to Paul to introduce this item. Paul, if you could introduce yourself first of all, thank you.
Yeah, thank you, Chair. I'm Paul Mitchell. I'm the new Chief Finance Officer for the partnership. So attached to this report, you will see that we've got the audited accounts, a letter of representation, and a copy of the annual audit report. Accounts have been given a clean audit opinion, and there were no misstatements identified, and only 2 small presentational adjustments made. There were 2 recommendations in the audit report, you'll see, and the first one is around the submission of members' declaration of interest returns. And you'll see from the management response that we will be reviewing these and have them all updated by the end of the calendar year. The second is regarding the COVID reserve, and the letter was received from the Scottish Government on the 12th of September, citing their intention to reclaim any surplus COVID reserves and for this to be redistributed across the sector to meet current COVID priorities. There are ongoing discussions around this, and these are at a very early stage when no formal request has been received yet. Obviously, when we do receive more information, this will be reported to the IJB for discussion. So if you have any questions or queries in the accounts, I'll do my best to answer them.
Thank you, Paul. And I should say at the start that the RAPC committee did look at the draft accounts several months ago and did a good bit of scrutiny and oversight at that point as well. So you're presenting them today as they are now finalised, but there haven't been any significant changes since the last time we saw them. Okay, thank you. So over to people for questions. I see Dina. Dina, if you want to introduce yourself first, Dina, thank you.
Thank you, Luann. Dina Tissera, Councillor at Aberdeen City Council and member of the IJB. Paul, thank you very much. Your report was great. It was a great read. It was also good to see the KPMG report as well there. Just a couple of questions for you. Has the government given us any new money for winter planning?
There was winter planning money built in for the 21-22. There was 4.6 in the base budget. There's no increase in for the 22-23 monies yet, but there is 4.6 in the 21-22 for that.
I got more questions. I'm not sure if Sandra wants to answer something or.
I suppose just to add into that, we do as a partnership have access to the winter funding that's been given across the whole system. So we do have access to winter funding.
My other question is, Paul, there was a letter sent on the 12th of September by the Scottish Government trying to reclaim the reserves, COVID reserves. Can I know if we have a legal opinion on it and if there's a legal basis for this claim back?
The CFO network from Scotland have actually been in touch with the Scottish Government to ask for a legal backup for this, so we're still waiting for a response from them.
Okay. Chair, I have a motion to be put forward. Emma has my motion.
Yes, Dina, if you let us know what it is that you're wanting to say, and then we can have a think about that. So yeah, on you go, Dina.
Yeah, my motion is to make sure that the COVID money. Do note that we've received a letter on the 12th of September regarding the reclaim back from the Scottish Government in terms of the COVID reserves, as well as there's no legal basis yet for this claim, as well as the need for this money. We already know that COVID there's still pressures of COVID towards the coming days, coming months, and we need these COVID reserves to help us along with that. And if there's a decision to be made to call a special IJB meeting to discuss this, that would be my motion. I can put it on the group chat.
Okay, so essentially, Dina, just because I didn't know exactly the wording or what you were looking for, but you're asking for a special IJB meeting on the finance once we know more about the Scottish Government requirement.
That's right. Yes.
Yeah. Okay. Paul, is there any comment from yourself at this point on that?
The management response on the audit recommendations mentioned once we receive any further information, it would be reported back to the IJB for discussion and decision.
Okay, thank you. I see Emma's got her hand up.
Thank you, Chair. Yes, just asking if Councillor Tissera would like me to put her wording to circulate her wording, or if you're content to put that in the chat as you suggested, Councillor Tissera.
Emma, it would be great if you can circulate it, because I can't put the letter on here.
Okay, thank you. Could I maybe suggest that we have a brief adjournment, please, while I just make sure that we have all the correct wording?
Yeah, Emma, I think that's fine. Yeah, and then we can come back and have a discussion with all IJB members. How long do you want to take to look at that? Do you want, say, 10 minutes? Is that enough time just to consider it and ensure that it's all the right stuff? It's competent for us to consider. Emma?
Yes, please.
Yeah, okay.
I will continue the recording, so just to make members aware that if they could mute their microphones and put their cameras off, please.
Okay.
Thank you.
So colleagues, we'll take 10 minutes just now, just we're having our comfort break early, we can say, for other people, and we'll come back at 10:53. And as Emma has asked, if you can put off your cameras and mics. Thank you. Welcome back, colleagues. Hopefully that's given people some time to stretch their legs or get a bit of caffeine. Just give people a minute to come back in. I see Emma has put in the chat the motion from Dina. Just give people a minute or two to read that and consider that. I have a suggestion to make, but we'll just give folk a minute to come back into the meeting first. So Emma, can I check that we've got folk back in the meeting that we need for this? Emma looks like she's doing a head count.
I am. Yes, yes, we do. Thank you, Chair.
Thanks, Emma. So we have Dina's additional recommendation for report 6.1, which is in the chat, which is to agree a special meeting of the IJB to fully discuss all options and receive written clarification of the legality of the Scottish Government's demands to claw back such funds. So that's the motion we have. Martin, before I let you come in, I see your hand up. So I was reflecting on this, and obviously the financial stability of the IJB is really important for how we go forward. Our next IJB is on the 29th of November, which is only next month. It feels to me that there's a number of moving parts around different allocations of funding that we don't know about or aren't confirmed yet. And we also have the CFO network that Paul described, who are already looking into this. So I'm really mindful as well of staff just capacity and time at the moment, and whether, rather than having a special meeting, that we ask for a special or an update report on the financial position on our 29th of November meeting, which would give Paul the time with the CFO network to confirm the legal position, but also just to give us a wider sense of the financial, the funding that is coming in this year. For the IJB for this year and beyond. So it gives us a wider focus than just the COVID issue, but actually just looking at all the funding coming in, what's confirmed, what's earmarked, what's, what do we not know about yet. So that would be my view, to use the next meeting, but to have a special item on it, which is around the IJB finance element, to include what's happening with the COVID monies, but also to look at the wider funding streams coming in. So that would be my suggestion for how to deal with that. If I can go to Dina first, does that sound, would that address your concerns, Dina, if we did it then?
We're talking about over 9.7 million pounds, and if they're, from my understanding, speaking with other IJB colleagues and COSLA colleagues as well, on the legal basis, there's a discussion, not confirmed, but one of the legal basis is that I think the IJB members can only decide regarding the COVID funds to be claimed back by the Scottish Government. And because of this, it's a big sum of money, and I think it is really useful for us to locally have that money and to deal with COVID. COVID is not over yet. There's aftermath of it. We're dealing with aftermath of it, and we might see more spikes of COVID as well during winter time, Christmas time, and going forward as well. This money is very, very important for us locally to have it, especially during the times where there's loads of cuts and difficulty as well in terms of funding what we want to shape health locally. So I think it's very important for us. If there is any legal opinion, we need to have the discussion then. If that does not fit in well within the next meeting in November, I think we should call for a special meeting.
Thanks, Dina. I'll bring in Martin now. Martin.
Yeah, thanks, Luann. Yeah, I think, Luann, what you're suggesting is very reasonable. But what I wanted to ask was a kind of a technical question. Maybe Emma can help. It was to ask the remit of the Risk Audit and Performance Committee in dealing with discussions around the annual account. Would that not be either a first port of call or somewhere where these issues would be addressed? I don't know if that's Emma or I don't know, Fraser or someone. Sorry.
Emma, do you want to come in?
Yeah, the next RAPC is earlier than the next IGB. It's the 17th of November, but I think I'll defer to legal colleagues for further advice, please.
Hi, Luann. Hi, Jess Anderson, IGB's legal advisor. So the IGB and RAPC would be able to consider the report in terms of the funding itself. Paul's already advised that at the moment the position is unclear around the legality. So both options are available, either the special meeting, which, as I say, would, I guess, you need to consider how much information would be available at that meeting and whether we were going to have that available to us for those dates, or as you've suggested, Luann, a wider report that considers funding more generally, but also an up-to-date position on the COVID funding.
Thanks, Jess. Paul, can I ask, what's your sense of when you will have a clearer position, or is that difficult to determine at this stage?
Yeah, I don't know when we're obviously going to have a response from our queries from the CFO network, and also the COVID reserve was a ring fence reserve, so there is quite tight criteria what we can use this for and what we can't use it for. But I'd be surprised if we get anything for the next RAPC and even probably for the November committee meeting. I could chase it up again and see what they're saying, but I'd be surprised if we get in that tight timescale.
Okay. So on that base, okay, so that basis that if we were to have a special meeting, it might actually be later than the end of November, Paul.
Well, just no indication of when we're actually going to receive it. But in the meantime, we do continue to fund the COVID spend. There is COVID spend coming in from the supplier sustainability payments and stuff like that. So we are continuing to spend this money. The forecast of the 9.7 mentioned is a forecast. You know, it could go up or down, but we are continuing to fund relevant COVID spend as it is.
Okay. So yeah, so the question about it's not affecting how we're using it currently. Okay. The other route open to us is to raise this through the National Chairs and Vice Chairs network of IJB chairs and vice chairs. And I'm very happy to do that because I know that this isn't an Aberdeen issue, this will be happening across Scotland. So that's something that I can take as an action from today. So I suppose, yeah, what I'm suggesting is something a little bit different to what Dina's suggesting, but essentially is covering the same thing. I'm probably just looking at it from a wider base, and also thinking of building it into existing meetings. It sounds like RAPC might be too soon, but we would at least have a better, we'd be able to get a reasonable update on the financial position at the next IGB at the end of November. And what I would be looking for in that would be the wider report on finance, if there's any further clarity on the financial position around COVID monies and what they mean, how the reallocation of that funds would happen. Are we going to get it back to Aberdeen in a different form? And also taking that through the chairs and vice chairs network would be my suggestion. But John Tomlinson, you have your hand up, John.
Yeah, I'm just wondering if this may be too simple, but if it's a question of reporting to the next IJB in November or earlier at a special meeting if the information is available, and that would if that would satisfy what Dina is looking for. It seems fairly straightforward on that basis.
Yeah. Dina, what's your thoughts if we amended you're adding an additional recommendation, but to amend it to just get the timescale right for when we have the information.
Yeah, I'm happy. Yeah, exactly. Yes. Yes, absolutely.
Okay.
And that's kind of what it says, to fully discuss options. I think instead of and, we can say when we receive legal clarification information, I guess. Yeah, I'm happy with what John Tomlinson said.
Okay, thanks, Dina. So we would change it slightly to add in a recommendation that we have. Well, I suppose it's just that we're not having a special meet. We're either having it at the IJB in the end of November, or we're having a special meeting depending on the timing, to fully discuss the to discuss the position around the COVID funding that the Scottish Government have written to us about. But I would also like us to get an update on the wider funding as well at that meeting. Sandra.
Yeah, I wonder if it would also be helpful for, as Paul suggested, the funding does some really tight spend. It's not as if it's just a straight, here's 9.2 million that's getting taken back. It's actually really limited in its availability, and I think that will be highly critical for the IJB to be made aware of the limitations of that spend currently anyway. So I think that would be helpful to make that absolutely clear.
Okay.
And a suggestion, I think just picking up on John's, is the recommendation, an additional recommendation that the IJB want updated as soon as practically possible on this. Is that what you're seeking? Whether that's a meeting or whether it's an IJB?
Yeah, Sandra, I think it's, well, reading what's there currently is as soon as practically possible, either through a special meeting or through the next scheduled IJB meeting. Yeah, okay. So here's what I'm suggesting as wording then, that we add a recommendation that says that we IJB request an update on the financial position as soon as possible, either through a special meeting or through the next IJB meeting, to provide clarity on the legal situation around the COVID funding, the limitations of that spend, and the wider funding that's coming through to the IJB as we know it. Yeah, well, I see two more hands up. John Cook and then Christian.
I was just going to ask on what the wording of the slightly revised motion was going to be, but I think what Luann just said was perfectly fine by me.
Thanks, John. Christian.
Yeah, it's perfectly fine if we, after the last conversation we had regarding a possible update, if it's a positive update, I don't think we need to meet, I would suggest.
Yeah, Christian, I think we would have that, if it was a positive update, we would have it in the next IJB just as an update from Paul. I mean, it might be a short paper, but yeah. Yeah. Okay, Dina.
Luann, I would like this recommendation to be solely on the COVID reserves and not the other funding coming in. I think that's just, taking the whole point of this amendment out. So this is just solely on the COVID reserves.
Okay. Well, I guess that's maybe for us as an IJB to determine then, because my thinking is we need to understand the wider financial picture and understand the other funding streams coming in, gives us a more rounded view of our financial stability or otherwise. So I suppose there's two elements there. Emma, Jess, maybe help us with the process here around, is that then for IJB members to decide and take a vote on, are we going for the COVID only money, or are we seeking a wider update? And we ask IJB members to decide on that. Jess.
Sure, Luann, Paul might have something to add to this, but in terms of how we deal with this in the IGB, it would be a matter for you to ask the IGB individually for their view on which option should be taken forward.
Okay.
So I would do that perhaps by just going around each member, and Emma can take us through the Cerident for that. Paul has got just something to add.
Thank you.
Yeah.
Paul, and come.
Yeah, I think one of the important things here about the COVID reserve is the criteria that we can use it for. So there is quite tight criteria. So if you would like an update on the details and what the criteria, what it can and can't be spent on, that might be handy, because you know, even if the IGB members come back and say, right, we're not going to hand the COVID reserve back, we are actually limited in what we can spend it on.
Yeah. So yeah, so part of that, the reallocation is an important part of understanding the situation.
Yeah, because
Okay, John Tomlinson.
Yeah, if I'm understanding this right, then do we not just put 2 additional recommendations in, one which is discrete to what Dina's asking for and one that's discrete to what you're asking for, and then that covers both, but leaves Dina's one sitting in there as she's requested? Is that too simple?
It may not be. I just think on its own, it's not given us the full picture of our financial position. So
But that's why I'm saying,
just
so
add in an extra one.
You put your recommendation in alongside it, so you just have 2 rather than vote between them.
Yeah. Okay.
It's not either or. What if it's both?
Yeah. Thanks, John. Jess?
Yes, Luann, is the point being for you that you would want to both considered at the same meeting?
Yeah.
Okay, so they would both need to have the same specifications in there about either the next IGB or a special meeting, whichever is sooner, depending on the information or otherwise, or clarification that we can get around the COVID reserve.
Yeah. Because it might, so I suppose in my simple mind, I'm thinking that if there's some reallocating of money that gives us more flex in how we use it, that actually could be a good thing for our partnership, rather than it being very narrowly required. John Cook.
My preference would be just to go for Luann's wording, because I do think we need to look at the kind of financial picture in the round. Because if we look at the subsequent agenda item on risk, we've got a whole bunch of stuff on cost of living crisis. We've got a whole bunch of stuff on recruitment, and I think just taking time just to look at one specific aspect of the finances, which is quite, as Paula says, has got quite tightly defined criteria, isn't really being strategic. And I think we've always tried to be consensus based at IJB, and apolitical. So I just think I'd be happy to go with Luann's wording only.
Okay, John. Jess?
Sorry, that was probably a bit of a legacy hand there. It's been up for so long. Apologies, Luann. I suppose it's just clarity for us as officers around the ask in terms of report for here. Because Paul will be looking at this in a one, and the COVID is part of that. I take it we're not asking for 2 reports on that, or could it be an extract of that answers Councillor Tessera's question around funding? Because the rationale is the one report deals with the whole funding issue. It's just one small part of that will be a particular stream, which is the ring fence COVID. So it would make sense to have it perhaps in the same report, but that we can reflect a recommendation that says that the both will be identified within it.
Yeah, that was certainly what I was thinking. It wasn't to dismiss the question about the COVID ring fence money. It was to understand the legal position on that and where we'd got to with that, but also to understand any additional funding that had then been confirmed. Dina.
So I put forward an amendment, a recommendation. So I think according to standing orders, we can take it, right? I'm happy with the recommendation that I put forward, and I would like that to go forward. And Luann, your recommendation to have the other finance streams can be added as a second recommendation, in my opinion, as John Tomlin suggested before. So that can be 2 recommendations, and the other financial stuff can also be discussed maybe in that second meeting, and it can come in here as a second recommendation. So I don't know, if you look at the standing orders, I put forward a amendment, and I would like that to be my amendment going forward as a recommendation for the report. Thank you.
Thanks, Dina. So who've we got? I'm looking at hands up. So we've got John. John, your hand's down now, or?
Sorry, legacy hand.
Okay. So, okay, what I'm suggesting then is that we have 2 recommendations. We take Dina's recommendation with the changes about, we'll request an update on that as soon as it's practically possible. And the second one is that we, as soon as it's practically possible, have an update on the wider financial position for the IJB. My expectation would be that is taken, even though it's 2 recommendations, that we have that in the one report, because we need to understand the whole together. Dina, are you comfortable with that? Yeah, okay, so you're having your recommendation, but we're adding an extra one so that we're seeing it in the fullness of other IJB financial situations, and we have that as soon as we have the relevant information. So there is an option of RAPC that feels quite soon, but we would aim for having that report at the end of October, sorry, end of November IJB. Yeah, John Cook.
I can live with that if Dina's motion was amended slightly to say and receive written clarification of the legality of whether Scottish Government can claw back COVID funds.
Okay, John. Is that much different to what's there already? That seems reasonable to me.
It's a minor change. It just feels like legality of the Scottish Government demands clawback such funds seems a bit political, and at IJB we try not to be political. I'm perfectly happy to look at whether it is legal for Scottish Government to claw back the funds, and I'm perfectly happy for us to be robust with Scottish Government on this issue. It's just like demand just sounds a bit overly political, that's all.
I would be content with that. I think it's really important as an IJB that we do consider these things fully and seriously, but not in a party political way or in that way. So if there's language that can be changed to make that feel less political, I would be really keen that we do that. It doesn't change the intent of the recommendation. Dina, are you comfortable with that?
So, sorry, what word did he wanted instead of demand?
John, what was your word in? I think it was just a softer way of describing the same.
It's making the same point. Yeah, it's basically making the same point, but just saying and receive, happy with the first half of it, receive written clarification of the legal position regarding the possibility of Scottish Government reclaiming the previously allocated COVID funds. So it's making the same point, but it's using non-political language, and I can certainly live with that.
I would be content to do that. Dina?
I'm happy to change Scottish Government claiming back such funds.
Yeah. That's fine. John, I'm sure that'll cover what you're after. It's just taken out the emotive element of the language. Yeah, okay, thank you. I think we have reached a conclusion which we're all happy with. Hurrah, fantastic. So, and I'm not going to just go over all the wording. I think we've got the wording in there. We're going to take out the emotive demand bit. We're going to say as soon as is practicable, as soon as we have the relevant information, and we'll add an additional recommendation, which is to have an update on the wider financial position for the IJB, and we'll combine those in a single report, which we would aim to have to the IJB on the 29th of November. Or before or after, if that's the timeline that has us the most relevant information. Okay, we're content. Are we all happy with that? Yeah. Okay. I'm seeing thumbs up and nods. Thank you, everyone. Thank you, Dina, for bringing that. This is for me. This is a learning experience about how we do these things, but it's important that we work through this together. And the financial element is really, really important for our IJB. So we have to give this the proper and full scrutiny that it deserves. So I think we have done that this morning. Thank you. So going back to the item 6.1, with the additional recommendations that we've added, are we content to agree the recommendations that were already there? There were 4 of them on page 3 and 4 of the pack. So it was to consider and agree the IJB's accounts for 21-22, to instruct the Chief Finance Officer to submit these to NHS Grampian and ACC, to instruct the Chief Finance Officer to sign the representation letter, and to note the recommendations and management comments on the annual report. And then we're adding an E and an F as well, based on our discussions. Yeah, good. Okay, thanks everyone very much. How are we doing for our time now? We're okay, we're fine. So the next item is, I think, the Strategic Risk Register, if I'm following things correctly. Yeah. So do we have Martin Allen this morning?
Yes. Hi, Chair.
Hi, Martin. Could you introduce yourself, please, Martin? Thank you.
Yeah, thank you. I'm Martin Allen. I'm Business and Resilience Manager in the partnership. So the board has before it the updated version of its risk appetite statement and strategic risk register. In relation to the statement, the IJB members at a workshop in August considered the board's risk appetite statement and made some amendments to the document to reflect the risk appetite in August. The revised risk appetite statement is attached at Appendix A to the report. In relation to the risk register, again at the workshop, members considered and fully reviewed the register. The updated version of the register is attached at Appendix B, and it's based on comments and views expressed at the workshop. The risk owners have undertaken both updates and additions, and these are in red text in the Appendix B to reflect the workshop outcomes, as well as some general housekeeping on the risks. At the last IJB meeting, the board considered the high-level outcomes of the workshop and agreed with respect to cost of living increases to instruct myself to discuss this with the risk owners and the senior leadership team, with any revisions in this regard to be presented to this IJB meeting. So the attached revised risk register references cost of living increases in the relevant risks. Appendix B also reflects the views at the workshop that 3 of the risks should be de-escalated. These are risks 4, 6 and 10. The views at the workshop were that risks 4 and 6 were no longer strategic risks and related to risks at an earlier point in the integration process, while risk 10 was operational. So risk 10 will be managed through the partnership's civil contingency group. The report also provides a bit of information on the reporting of strategic risks to both the IJB and the Risk Audit Performance Committee on a quarterly basis. Also, the Risk Committee reviews the risk register for the effectiveness of the process annually. At the last meeting, IJB also agreed to review the risk appetite statement and the risk register in another 6 months, given the changes happening in the health and social care sector and in the wider external environment. So it's proposed that the review take place during the first quarter of 23-24 and will form a workshop for IJB members, with the outcomes being reported back to a future IJB meeting. I'm happy to take any questions, and we've also got the risk owners in the meeting if there's any specific questions in relation to the risks. Thank you.
Thanks for that overview, Martin. I'll bring in Christian.
Yes, thank you very much, Leon. It's on page 68, And it's more a technical question than anything else. It's regarding recruitment again and retention. And the problem that I have is because we were on very high already, we've almost set an extreme top of the charter and no change. But can we have some background on that? Because if it is a change, if the situation is getting worse, is there a way we can put it in this report, in future report, because even if it's almost at an extreme and very high, I'm asking the question is with the recent event, if the retention and despite the very good answer that we had early on, if that's getting worse, how are we going to monitor this and how are we going to reflect that on our report?
Martin, do you want to come in on that?
I see Sandy's got his hand up. Maybe if we go to Sandy Reid first of all, and then I'll come in the back of that.
Thank you. Yeah, I'm Sandy Reid. I'm the lead for people and organisation. Hello, everybody. It's a good question, and to be honest, if we had a higher risk rating than the one we've got for this, I would have proposed that we put it to that point. So I think it's a very good observation. I guess all I can do is try to give some assurance to the IJB to say we are trying to do everything that we can to reduce that risk. One of the key parts of that will be to bring forward to you at the next meeting our finalised workforce plan, where we're putting a big emphasis on retaining people, attracting people and looking after staff so they see it as a good organisation to join and remain in. But it would be true to say, I think that the paradoxically, as we struggle post-COVID to retain and recruit people, many of the industries in the northeast of Scotland, which is good, are having an upturn, and it makes retaining those staff, particularly admin staff, really challenging. So we're in a really difficult position, but I'm hoping and be quite happy to have more scrutiny on what we're planning to do and our actions at the next meeting on our workforce plan and our proposed priorities. I'm happy to answer any further questions.
That's very helpful, Sandy. Thank you very much for that. I wonder, Luan, if we could have to help officers to fill properly all this report, having maybe changings to no change, making sure that there is a notification somewhere right at the top, but there is a change. The situation is getting worse, but unfortunately there is no wording which we can show that. So I don't know if it could be critical or something else, but having a line there will be very helpful, just to make sure that we don't feel that we are content with no change.
Thanks, Christian. Martin?
Yeah, just on the back of Sandy's comments, just maybe to hopefully provide a bit more of assurance. Senior leadership team will be considering the strategic risk register at this meeting on a monthly basis. So I suppose if there's any things that we need to add in, etc., then we're on top of it on a monthly basis and looking at all these strategic risks. So certainly there will be movement into the live document, and we will be updating it and reporting back to IJB and the RAP seat committee as well.
Thanks, Martin. And it's absolutely our intention to use this as a live document. I would also add, and I think we'll see it in the workforce plan, that the solution to workforce is not just through more people, but it's also about how we use digital really well and innovations and different ways of working. So I think we'll look forward to seeing that coming through in the workforce plan as well. John Tomlinson.
Thank you. I was going to suggest that possibly the next RAP committee, which I think is the 17th of November, so this is a question to the two Martins, would have a deeper dive around number 2, which is the finance bit, just on the back of our earlier conversation, which I think would be helpful prior to any further consideration of that in November or at any special meeting. But maybe in light of what Christian's just been saying, maybe 2 and 8, which is the 2 big resource issues, the finance and the staffing. So maybe if some consideration could be given to that in planning the agenda for that meeting, but maybe it's a question for the 2 Martins to respond to.
Thanks, John. Martin Allen, Martin Gregg.
I'll maybe defer to the chair of the committee and get Martin's views on that.
Yeah, just to chip in and say that I completely agree with John Tomlinson there. I think that these are two areas naturally fitting together that need quite considerable attention and reflection. Yeah, we need to do a deep dive. Particularly, I mean, the staffing, recruitment and retention is such a huge concern, and it's been identified rightly as such. Needs special focus. Yeah.
Yeah. Okay, so that's something for you both to take away and look at for the next RAPC. Great. Thank you. I don't see any other hands up, and I'm keen that we move on with our agenda today because we've still got a number of papers to get through. Are we content to agree the recommendations that are on page 41 to approve the revised risk appetite statement, to approve the revised risk register, and to note the documents will be reviewed by the IJB with an additional review in the first quarter of 23-24, as Martin has outlined. And we're also noting, and we'll note in the minute, that we'll look for a deep dive through RAPC on the finance and the workforce risks. Yeah, content with that? Yeah. Okay, thank you, folks. We'll then move on to our next item, which is the surge plan. Martin Allen, is it back to you for this one as well?
Yeah, I'll introduce it. Thank you. Yeah, so the board has before it a report which outlines the partnership surge plan. In previous years, the partnership has developed a winter plan to prepare for additional demand in the system over the winter period, following the response to the pandemic and the various waves of COVID infections, which have had an impact throughout the year. A more generic approach is proposed this year. By way of background, work has been ongoing to develop the surge plan, and it's in front of the board with an accompanying risk assessment in the appendix. In addition to that, NHS Grampian are drafting modelling, which the partnership's plan has been sense checked against. And there are weekly meetings looking at winter planning that the partnership are involved in. Also, the partnership been liaising with colleagues in NHS Grampian on surge and capacity planning across the wider system. It is proposed that the senior leadership team continue to monitor and update the plan at its meetings, where strategic risks will also be looked at, as well as any emerging risks. So we'd picked up about that in the last item as well. In addition to this, clinical risks are scrutinised on a weekly basis through the clinical care risk meeting and will be fed through the clinical care governance structures. Members of SLT are in attendance to answer any specific questions. Thank you.
Thank you, Martin. I'll open that up. This has really been provided for members to note and to have awareness that this plan exists and that it is regularly reviewed and overseen by the SLT, and yeah, no longer relevant to call it a winter plan, given the pressures the system is experiencing. I'll bring in John, and then I see Kim. Oh, sorry, the other way around, actually. I think Kim's first. Just Kim, in you come, Kim, and if you could introduce yourself, thank you.
Hello, it's Kim Crittenden. I'm a non-exec member of the NHS Grampian board and obviously an IJB board member as well. I did just a quick question for point of clarity on page 84. It's about the hospital at home capacity. I seem to recall, but I may be wrong on this, that it was it was actually a standard plan to increase the hospital at home capacity to something around that sort of 40 beds. And I wondered if it was actually a plan anywhere, if it's actually part of a surge plan. So therefore, is it going to come and go? So are we planning on increasing, then decreasing potentially? And I guess because it's almost doubling the number of beds, it's, is there already capacity within the team to do that? Or is this needing sort of additional resourcing and things? Just for a bit of clarity, but I may be remembering something a bit wrong. But thank you.
Thanks, Kim. So I see Fiona Mitchell-Hill has put her hand up. I'm hoping Fiona's going to come in and speak to the hospital at home question from Kim. So that's about, is it a flex approach, and or is it ongoing, and is there capacity to deliver that's required? Fiona.
Thank you, Luann. So I'm Fiona Mitchell-Hill. I'm the lead nurse for Aberdeen City Health and Social Care Partnership. Nice to meet you all. So Kim, yes, so in hospital home sits within my remit as well. So it is increasing up to the 40 to 45 beds as part of a longer term plan, Kim. So as much as it's part of the surge plan, it is that longer term. So we have got funding for that increase already. We've already got that within our budget. And what we are doing is we're actively recruiting staff, and we're also training within our team as well. So we've got some trainee ANPs in, which will help us. And we're also advertising for qualified people. Does that answer your question, Kim?
Yeah, it does. Thank you. That would be really valuable to the overall picture. But thank you. That was kind of how I remembered it. Just want to check. Thank you.
Thank you.
Thanks, Fiona, for that answer. We'll go to John Tomlinson and then John Cook.
Okay, thank you very much. Yeah, it's really useful to see this and to note it is fine, and it gives a lot of assurance. So that's really helpful. As I read through it, there was one element I was just curious about, which isn't in there. Maybe it's somewhere else, and maybe it's within one of these headings. But under operational resilience, it struck me that the reliability of the public's access into the system is a key element of that system being resilient, i.e. into GP surgeries or NHS 24 or hubs or whatever. And we know the reliability of access into the emergency department is problematic. So I'm just wondering if that element is getting particular attention. Maybe it's somewhere else that it's getting it, but I'd be interested to hear a little bit about that, please.
Thank you. Through you, Chair. Yes, that's been referenced in the weekly meetings that NHS Grampian are looking at in terms of the kind of, I suppose, the clear message to people accessing the system. So that's certainly reflected in work ongoing there. It's maybe something that we can reflect in our surge plan as well, John.
Yeah, and just to be clear, I understand the communication to people, but it's like, are these reliable for people to access when they knock on the door or dial in?
I see Sandra's hands up, John. I'll bring Sandra in on this point.
Yeah, I suppose part of the wider context is the Unscheduled Programme Board, which is a whole system response to our urgent and unscheduled care across Grampian. There's a piece of work being undertaken there in which this surge plan from Aberdeen City will feed in along with Murray and along with Aberdeenshire surge plans, which will then interlink with the work that's getting completed under the Unscheduled Programme Board, and we will be looking at any gap analysis. So the areas that you're picking up, John, about access to front door, access to GPs, access to primary care, they're all part of that wider system. So this is part of the systems plan. This is the Pacific response here, but fundamentally will be getting picked up there as part of the whole system. And I think there has been, interestingly, I think that operational resilience, one of the key points that we think was in the Chief Officer's report and an update and things that we'll be doing is the support that we're giving to GPs, particularly on that messaging, that operational resilience, and ensuring that people, not only when they knock on a door, the door is available, but as well as getting the right door. So I think that is part of our key plan. But that wider and broader picture, it's not something specifically that the partnership will, but we can certainly feed into that broader system.
Okay, that's really helpful. And for our assurance as IJB members, that would be useful if even if it comes back in the Chief Officer's report or whatever, just some reference to the progress on that.
I can take an action, John, on that wider report. So that wider report, is my understanding, will have to go through PAFIC and potentially clinical care governance from an unscheduled programme from an NHS. It may well be worth us bringing that back through clinical care governance to the IJB. We could put that in for even for noting, because it's not an approved, the same as when this goes forward to those areas, it won't be for approving, it's already approved here, but it is for noting. So that might be helpful just to share those with the IJB to give that whole picture, if that's helpful.
Yeah, that would be, because I think that, along with then the public expectations, that they're kind of longer term things for us to work at, but we need to work at them explicitly. So that's really helpful, Sam. Thank you.
Thanks, John. So yeah, an action there to take the wider whole system approach through the Clinical Care Governance Committee. I know there's a number of hands up, but Kim, did you want to come in on that point specifically as chair? No, okay, I'll just do it in order then. So we've got John Cook next and then Alison Murray. John.
Thanks, yeah, and apologies, I had to step away for 2 seconds there. It was on page 79, and we're talking about the COVID and flu jab programme, it's shown as amber in the RAG analysis. So I just wondered if we've got any, what can we kind of do about that? I'm just thinking that last time I got my JAGs, that was delivered by a sergeant from the Royal Army Medical Corps. So are there any plans to bring in the forces to help out on that?
I see Sandy's hand up. Sandy, answer that question.
Yeah, two questions there. I think the reason it's in amber is we're thinking it is until we have completed the full autumn winter programme, we can't be green. So it's a sort of on track, but we haven't finished yet. Sort of a simple description. In terms of what can we do, I would encourage, never miss an opportunity, to anybody who's eligible, go into the National Booking Portal and book your appointment. We are still desperately short of staff, and particularly for some of the bank shifts on a Monday and a Friday. So if you know anybody, encourage them. And the answer is no, we won't be getting any help from the military, or that's a total non-starter for reasons you can understand. They're elsewhere. And their current position is that Sandra's position and Grampion's position is we won't be moving people from Service A to help the vaccination service. So we're going as fast as we can with the amount of staff that we have, but no plans at present to move people into the service who do not work in the service.
Thanks, that's really helpful and informative. Actually, in terms of encouraging folk, would it be possible to just put around a kind of wee note with relevant links to, actually I was going to say elected members at IJB, but actually all elected members, so we could then amplify that on social media, just to kind of, get the message out there. If it's a case of encouragement, the more publicity we can get, the better, if that's possible.
Sandy, is that a takeaway for you today? So
yes, yeah. I think also maybe a sort of an opportunity, if Fraser thinks I can just share this. One of the things we're looking to do is harness the power and the reach of elected members, and potentially try to have a meeting soon with you to explain what's going on within the vaccination programme, and to harness your wider reach that we have to kind of get various messages out there. So we're looking to set that up quite soon. And there'll be a sort of opportunity then to have more deeper investigation into some of the issues. But really, we need your help is the kind of the main headline for that meeting.
That's great, Sandy. Sounds like that'll maybe more impactful than an email going around, actually, to have a conversation with elected members. That's great.
I'm sure everybody would be totally up for that. So yeah, great.
Okay, thanks, John. So we have got 3 more questions, and then I'm going to move to recommendations so that we move on to our next papers. So we've got Alison Murray next, and then Kim.
Hi, yes, a couple of related things, sorry. One was about the messaging. I just have a concern. I was thinking with some of the messaging that went out around A&E, is that people don't want to be a bother if they think things are stressed, and therefore they won't seek help when they need to seek help. And they will avoid going to A&E because it says you have to be life-saving, it has to be a life emergency, and they don't feel it, they don't know it is, though perhaps it is. And so there's that concern. And there's also, I notice it says in the report that there's no impact, there won't be any impact on unpaid carers, but all of that pushes onto unpaid carers at the end of the day. It does happen when there is a surge in demand and there are sort of restrictions in supply of services, then that all lands on unpaid carers. So I don't think we can say any surge plan will have no impact on unpaid carers. It should have an impact on unpaid carers because it should consider them, or either in a positive way, or it might negatively impact on unpaid carers because everything's landing on them at the end of the day.
Thank you, Alison. Very relevant points, reminding us of the importance of our unpaid carers out there. I don't know if anybody wants to come back specifically on the communication element that Alison has raised as well, and the importance of that balanced message going out, or are we noting that?
I think in the plan it does say that the partnership will continue to communicate anything that's coming out from our statutory partners or from ourselves, and make sure that that is communicated as widely as possible. And but we'll take, I think, and also in terms of the implications for unpaid carers, I think that's something that perhaps should have been reflected in that part of the report.
So we'll note that, and probably for future reports, maybe to give maybe more consideration about the impact on unpaid carers. Yeah, thank you, Alison, for raising that. I'm going to move now to Kim and then Dina, and then we're going to move on to the next item. So Kim.
Yeah, thank you, Chair. Just two quick questions on the back of what John had asked and Sandy's comment on the sort of staffing gap around vaccines. I just wanted some assurance that we were maximising our utilisation of community pharmacy to help with this, the vaccination process. And my other quick question was, what is a winter staff pack, just for clarity? Safety pack, sorry, on page 85, I think it is, just for clarity. Thank you.
Thanks, Kim. Sandy, do you want to come in on both those questions?
Yeah, I can try. Thank you, Chair. The last one, what it's maybe a sort of grand title, but last year we bought boxes, sort of plastic boxes that you put in your car that would have things like stuff to spray your windscreen, scrapers, torches, alarms, so that people would feel safe, staff would feel safe driving to and from their work or driving as part of their work. So that was the sort of that was that one. Community pharmacy, yes, Grampian has engaged and contracted with them. Their main focus for community pharmacy thus far is that when the vaccination team visits schools and little Jimmy is missed and we won't go back to the schools, and parents can go to their nearest pharmacy and book an appointment there in lieu of missing a school appointment. And that happens a lot because loads of times they miss and then immediately say, when are you coming back to school? So yes, they are part of, and we would be stuck without them contributing to the programme.
Okay, thank you. I've seen Kim nodding. Thanks for that question. Alison, your hand's still up. Did you want to come back in, or can I move to Dina, Alison? Your hand's up now.
Sorry.
Okay, thank you, Alison. Dina.
Thank you, Luann. I want to echo on what Alison said before regarding NHS message about asking the public to be considerate because of the pressures that the staff are having in the NHS. So kind of like saying, don't come in unless you're literally, very, very serious. That does put a pressure on unpaid carers a lot. So I wanted to echo on that. I got a question on the flu vaccination program. What's the progress on getting the vaccination program out and getting all the elderly and care homes and sheltered housing people vaccinated? Can I know the progress on that, please? Thank you.
Thanks, Dina. I'll bring in Sandy again for that answer, I think. Sorry, Sandy, I know you didn't even put your hand up.
It's good to talk. Two, three things then. We started first in Aberdeen, and so did Grampian, in care homes. They were priority number one. So they are at the top and should always be at the top, and we did nothing before care homes. So broadly speaking, unless people were absent or unwell, then everybody will have got their care home vaccinations. Over 80s, elderly, it depends what elderly means. A large part of them are housebound. We're now started, but not as far ahead in the housebound programme as we were before. You mentioned sheltered housing. It is a query that we get, but basically we don't go to shelter housing and kind of go around the houses or the individual tenancies providing. We get asked for that quite a bit, but we don't individually go to sheltered housing. We try to invite those people, unless they're housebound, would be able to book appointment to the 3 locations in the city: Airy Hall, Bridge of Dawn, and the vaccination centre in the city centre.
Thank you. I got a follow-up question as well for that, Luann. In terms of the staff who are working in care homes and sheltered housing, how about their vaccination?
The staff, including in the care homes, those staff we encouraged and wanted them to get vaccinations at the same time. So that was strongly part of what we wanted to do. I would say anecdotally, and this is maybe a societal thing, uptake in vaccinations in care home staff is less than we would want and less than it was last year. But it's not because of a lack of effort. We've had multiple times given them notice to say, we are coming, please bring in your staff who don't work on that day. So we've been trying everything we possibly could, but generally speaking, the sense is that uptake is reduced in that staffing group.
Thank you, Sandy, for that answer. And like all the areas, that's continually reviewed and being looked at as part of the plan for around vaccinations. Yeah, see Sandy nodding. Okay, I'm going to bring this paper to a close. Thank you, Martin, for presenting the surge plan paper. Really important that we have time to consider and scrutinise it. On page 75, we're simply being asked to note the surge plan as it's outlined, and note that the plan will be monitored on an ongoing basis by the senior leadership team through the Health and Social Care Partnership. Are we content with that? And there'll be a number of areas covered in the minute to summarise the discussions that we've had. So thank you, folks. That's good. So we'll now move on to 8.1, which is consideration of the draft carers strategy. I see Stuart has popped up on the screen, so I'm thinking Stuart's going to talk to this, and Amy as well. And before I open it up for questions, I'm going to invite our carer reps to provide their feedback and guidance on this draft strategy as we see it today. But I'll hand over first to Amy and Stuart. If you can introduce yourselves and introduce the report, please. Thank you.
Thank you very much, Luann. Good morning, everyone. My name's Stuart Lamberton. I'm the Transformation Programme Manager for Strategy and current chair of the Care Strategy Implementation Group. So on behalf of CSIG, Care Strategy Implementation Group, we're delighted to present the first draft of the Care Strategy here today. For a number of months now, CSIG and in particular Amy have been working hard to pull this together. As the covering report highlights, COVID had a significant impact on our ability to pull this together in line with previous timescales. And while it's been a long journey, we've looked to build on our previous strategy approved by the IJB in 2018. Amy is going to talk everyone through the key elements of the strategy itself, but before that, I just wanted to highlight a couple of key updates. Aberdeen City Health and Social Care Partnership were one of 5 health and social care partnerships across Scotland that took part in the recent carers inquiry, which concluded in August this year. Now, although we've had an initial conversation with the Care Inspectorate, we have not received the final report or Aberdeen-specific information we'd hoped to receive that would help influence our strategy. We have since followed up on these requests with the Care Inspectorate and hope to receive information very soon. Scottish Government have also not yet published the national strategy, which again we will use to help influence our local strategy where possible. And from being at the recent Carer Leads meetings that I attend, I believe that's not expected now until at least the end of November. They're taking into consideration cost of living, etc. So I wouldn't expect to see that before the end of November. But if we do before that, then that is a bonus and we'll get right on it. I would also draw your attention to the action plan at Appendix B of this report, as this sets out some of our key deliverables over the course of the strategy and hopefully helps answer some of the questions that may arise. We also recognise there's a gap between those who are carers in the city and those who are actively known to us. One of the key elements Amy will talk about is how this strategy seeks to raise awareness of the support on offer for carers, how to help those identify as carers, and also the upskilling of our collective workforce so we're all on the same page in relation to what support can be offered to help support carers moving forward. I would also draw members' attention to the consultation programme drawn up at Appendix D, both in terms of what has already been achieved and what is planned over the coming weeks, including our public consultation. We have worked hard to engage and ensure, as far as possible, the voice of carers is throughout our strategy. We are pleased to have engaged with the Children's Services Board recently, ethnic minority groups via our Equalities and Human Rights group, learning and disability with support from Catherine Payton's team, and adult parent carer groups are also in the pipeline too, as you will see from the consultation. Finally, I would just like to add that the financial information is being worked up as part of the development of the overall strategy, and we should have that available for the final draft due at next month's IJB. Just last week, we received some very good news regarding our Promoting Variety funding bid, which Amy will cover. Last thing I would say is this is a draft. I think it's important to say that and remind ourselves that it is just a draft at the moment, so all feedback and comments for improvement are most welcome. After Amy is finished, we'll do our best to answer any questions we can, and if we can't, I'll ensure that these are taken back to CSIG and relevant colleagues to get the answers and feedback where required. Thank you very much. I'll now hand over to Amy.
Morning, everyone. I'm Amy Richer. I'm Senior Project Manager for Strategy within the partnership. So I'll just briefly go over some of the key items within the strategy. So our strategy presented to you today aims to be reflective, informative and forward-thinking. You will note areas of development and good practice that are highlighted throughout it in the Spotlight On sections, and where any information about services is included, there are links on how to access these for the ease of carers. Our previous strategy, A Life Alongside Caring, was our first carer strategy and required a focus on the implementation of the Carer Scotland Act. A City for All Carers is the next step in our development of carer support and services in Aberdeen. Engagement on the strategy has been ongoing since the autumn of 2021, and an overview of the engagement so far is provided in Appendix D. Most recently, we have focused on ensuring we have more up-to-date perspectives of groups not within the scope of the Care Inspectorate inquiry that Stuart mentioned, and this has been young carers, parent carers and our workforce. The video this morning was particularly poignant when considering the impact of caring on our young carers. The strategy outlines 4 priorities, each with associated actions within the action plan, and we also include what we are aiming for carers to be able to say about the support they receive and the identified actions. These are considered in more depth throughout the strategy. So our first priority is identifying as a carer and the first steps to support. As Stuart has reflected, our data suggests there are many more carers in a caring role in Aberdeen than we are currently supporting. We aim to target this area in 3 key ways. Firstly, by taking a proactive approach to identifying carers, working collaboratively with our commission services to raise awareness of carers' support and carers' rights. We will also look to be more proactive in understanding the needs of carers across all communities in Aberdeen. And secondly, we will work to ensure that the workforce is equipped with the knowledge to support carers to identify and access support. Thirdly, we also aim to educate the wider public on carers' rights and carers' support to improve the likelihood that they would help a family member, neighbour or friend to access support. Our second priority is access to advice and support. This priority focuses on our support and advice services, which is universally accessible to anyone who has a caring role in Aberdeen. We currently have 2 support service contracts in place, an adult carer support service provided by Quarriers and a young carer support service provided by Bernardo's. And the specific information on these is included in your packs on pages 108 and 109. Our focus will be on ensuring advice and support is available to meet the range of carers, the needs of a range of carers in Aberdeen as determined by the carers themselves. Our third priority is supporting future planning, decision making and wider carer involvement. And this again is split into 3 areas. Supporting the carer to plan for their own support, supporting carers to be involved in planning for the support of the person they care for, and carer involvement in wider decision making within the partnership. Developing a carer reference group will be an immediate priority to support a wider range of carer voices to continue to be involved. Finally, priority 4 is community support and services for carers. There are 3 elements here. So the first is promoting a culture of creativity to develop our innovative approaches to support. And we recognise that needs and circumstances vary significantly and creative approaches are required. Our second area within this priority is supporting carers to access mainstream supports and activities. And finally, we will focus on developing more specific support services to enable carers of people with high level needs to have a break from caring. Within the action plan, and as Stuart mentioned, we reference developing the promoting variety approach. I am delighted that since submitting our papers to IJB, we have been successful in our bid to be part of Shared Care Scotland, The Lasting Difference and the Improvement Hub's Promoting Variety programme for 22-23. This opportunity comes with £50,000 of funding to develop short break services in Aberdeen. Our bid is focused on developing options for carers of older people with high level needs, but we will also work with other partnerships across Scotland, which will inform our learning and approaches to carer support across the board. Finally, this strategy is of course in draft, and our next step with the agreement of members will be to take it back out for a period of public consultation, as I outlined within Appendix D. This will involve a targeted survey on the strategy and consultation events to provide the opportunity for carers to share their views directly. The feedback from consultation will inform our final strategy, which we would aim to present to the IJB in November. Thank you.
Thanks, Stuart. Thank you, Amy. I will now invite Alison Murray to say a few words and provide her guidance on the draft strategy. I don't see Shona McFarlane with us today, but I would obviously give Shona the same opportunity. But I'm pretty sure Shona is not in the call this morning.
I am here.
Oh, you are, Shona.
Yes.
Great. Okay. Well, we'll start with Alison. Delighted you're joining us, Shona, and then we can go to Shona. So Alison, over to you first.
Hi. Yes. I mean, I think we need to start by remembering this was a document which should have been in place in spring 2021. When I say should, I mean we had a legal obligation to put it in place in spring 2021, and that has been delayed by, well, over 18 months anyway, so far. And that makes me feel quite torn, because it needs to be done, it needs to be completed. However, something I have said since spring 2021 is we needed more carer involvement in drawing this up. We have not had sufficient carers. The Carer Strategy Meeting Student Information Group has me, and that is not sufficient. Carer representation, sort of representation from people who provide services to carers is welcome, but that is not the same as having carers there. We have done very little to engage with people who are not currently already engaged with services. So we have, 15,000 carers in Aberdeen, of which we engage with a few thousand, and that the vast majority have not been engaged with or reached out to. Consultation with carers is not an optional thing in this strategy. It is a requirement. It is in the statutory guidance that we must do it. And just to remind ourselves what a consultation is, because a consultation is a defined thing. It must take place. Consultations must take place at a time when proposals are still in the formative stage. They must be presented with sufficient information to be put forward for allow people to make intelligent consideration of the proposals. There must be adequate time to allow for the consideration and response, and that's not 3 weeks. And the product and the consultation, the products of the consultation must be conscientiously taken into consideration. I don't think that has happened, and me being in the carer strategy is not enough. Moving on from that aspect, and I have repeatedly raised that, I'm a bit of a stopped clock when it comes to that. I have an issue with saying we're supported to what people support to identify as carers. That's sort of putting a load onto the carers. What we're actually required to do is identify carers. Even if they don't identify as carers, they still have rights as carers. And we have a responsibility to identify them, not for them to have to identify themselves as a carer. I wouldn't say I identify as a carer, I say I am a carer. And so I think we need to think through that. There are various other points I have issues with, which I'll continue to feed back through the consultation points, so I won't go through them all in detail, apart from a couple of other points. One was about emergency care. Emergency care, I couldn't find it other than within them saying there's an emergency planning segment of the adult carer support plan and young carer strategy. However, the statutory guidance makes it very clear that emergency care is a separate strategic consideration. Emergency care is a separate strategic consideration. It is not something just within the plans. That is, the plans are a separate bit, but the actual consideration of emergency care must be considered separately. And that is something which I think a lot of carers have huge concerns about. What happens if they cannot care for people? And to not have a segment on that, I think is not good enough. And then also just the other point I just wanted to make today was about actually disabled carers. There's not enough consideration of disabled carers. That's something else which the statutory guidelines make clear that we do need to consider the care needs of the carers, and that doesn't seem to be within this. It says it is, but I couldn't find it in the action plan. It wasn't clear if it was just in the provision of documentation. And when under section 1.15, when we're talking about all carers, there's no mention of disabled carers. And actually, even in the equality section, there's also no recognition of the fact that carers are associated persons and need to be considered. They fall under the Equality Act under disability themselves for direct discrimination. That's not mentioned there either. So I do have a number of other points which I will raise. But yes, I am disappointed that there's not been more carer involvement, and I feel torn because we need to get this carer strategy actioned and in place. And so I don't want to have even more delay, but 2 or 3 weeks of consultation on this draft is not adequate. Thank you.
Thank you, Alison. Getting feedback there. I wonder, before we hear back from Amy or Stuart, Shona, do you have anything that you want to contribute by way of feedback?
Yeah, I completely concur with what Alison has said, because there's many people that don't identify as being a carer, and I agree about the disability, and they're not defined here, or there's not a notion taken for them. What other things are missing here are the mental health aspects, and I don't see any link up here with partner associations such as Rape Crisis Grampian, Grampian Women's Aid, etc., within the document. Why are these not linked in? Because that's a heck of a lot of people that are going to fall through the net that perhaps suffered at the hands of somebody with a mental health problem that hasn't been able to access services, because these are horribly overburdened at the minute. And I've discussed before with Luann what my situation is, and I don't particularly want to go into that today. But having to link into services to then get psychological support was nigh on impossible for me as a carer of someone with a mental health problem that ended up abusing me. So I don't want to focus on that. If people wish me to discuss my experience, then I will. I don't think it's appropriate for this meeting. The other angle I want to take is this happened, and this shows you regarding the emergency services how this is not here. So I'm currently living in the country. There was a woman walking out in the country. We didn't know anything about her. She'd been with a man. She looked like she had a mental health problem, and I was going to call the police. She asked me not to call the police. We couldn't leave her outside. My partner drove her home and had to sit outside because there was a fear that she might accuse him of something. The ambulance crew couldn't attend. There was 3 police cars that turned up, and this woman, who was about 4.5 feet tall, was put into cuffs immediately. My partner was frisked, asking what his business was there, and that they believed that he had a weapon. That is a waste of resources, and we didn't know what happened to this woman because we were just trying to get her to a safe place. We assured her we would get her to a safe place. She ended up being arrested. I contacted the social work department to find out what happened to the lady, and I've had no response. So it was really quite worrying for us what happened to her when she was wandering about in the country in the dark. If that gives you an element of the emergency response, I don't think that's adequate, and I don't think it's appropriate either for somebody that had actually just been released from Cornhill Hospital, because she left her prescription behind in the house, in our house, when we'd taken her in to wait for somebody to try and help this individual. So if anybody's got any comments about that regarding the carer strategy, I mean, it's just a human response. When I asked my partner, what are you doing here? And he's like, well, I care. He said, I'm a mental health first aider. I'm also a counsellor. He said, you can't leave this woman just out in the middle of nowhere when she's asking for help. So, that's my comments regarding that, because I just think that this carers strategy just hasn't encompassed any of those situations that I've just discussed. Okay, thanks.
Thank you, Shona. I'm conscious of time that we've got today, and I do want Amy and Stuart to come back on these points, but I'm wondering if framing it in this way, one is to absolutely acknowledge and recognise the frustration that I'm hearing through Alison and Shona about the delay that there's been around the carer strategy. We would have wanted to do it back in spring 21 if that had been possible, but we are where we are with that. So I'm absolutely acknowledging and recognising the frustration that that's caused. I'm wondering if there's a number of sort of things I think could be maybe more explicit in the action plan that would accompany this, about just giving more detail on how we're proactively connecting with carers, rather than expecting carers to sort of put their hands up, but actually how are we using general practice and all sorts of places where people go to proactively reach out and support carers. So there's an ask maybe there about the action plan having some more details about that, and also the specifics around consideration about different types of carers, like the carers who have disabilities and the emergency care element. So it sounds to me like a number of them could be taken forward in the detail of the action plan, and also how we link up with third sector and Mental Health Aberdeen or Grampian Women's Aid or whoever the relevant organisations are, rather than it focusing on the Commission services. So not to to absolutely acknowledge the points that Alison and Shona have made, and just looked for them to come more in the action plan. And also, Amy, be interested to understand about the reference group, because I think that's quite an important way of taking some of these areas forward. So that was a bit of a spiel for me, but Sandra, I see your hands up as well. Do you want to come in first?
Yeah, that's great, thanks. And thanks to Alison and thanks to Shona for the comments. I think they're all very valid and all very helpful. I think what's clear today is that the paper is, even with the limitations it is here for, it is going out for consultation. So I think that the team will be able to take on board the points. We will reference them where we are. Appreciate the candidness and the valid points that have been raised. We'll take them on board and start to ensure that they're taken into consideration for the next draft. Thanks.
Thank you, Sandra. Shona, your hand's still up. Did you mean your hand to be up, or do you want to come back in?
Yes, it was just I'm just coming back in for a little bit. So when we were with the VSA, and obviously they had sight of us at Cornhill Hospital, and we could attend there and speak to somebody immediately. And it's kind of, it was on a demand service, really. When it moved to Quarriers, obviously there was information that was not transferred across. So I've only had a newsletter from Quarriers, and it came very, very much later. And I didn't know who the contact was in Quarriers to contact. So within that support group we had with at Cornhill, we kind of supported one another because we were kind of a recognised group. But once that was actually moved over on the service and there wasn't contact made with these individuals, unless we had their information ourselves, that was a huge amount of carers that were actually disbanded, because there's a lot of people that are not in contact with one another. So it's just to make that point as well. Thanks.
Thanks, Shona. I think that point is recognised. I've seen that recognised in the plan around that commissioning aspect. So with Shona and Alison's comments, with Sandra's input reminding us that this is a draft and the consultation will happen after this. Amy, Stuart, anything you want to pick up specifically?
No, just thank you, Lan. Just to echo the comments made by Sandra in terms of the team taking it forward, and obviously to thank Alison and Shona for sharing that information. We will work very hard and behind the scenes to make sure these are fed into the updated strategy.
Thank you, Stuart. Amy, anything you want to say, or happy with that? And we'll just open it up for questions from the wider IJB. Yeah. Okay. So I see John Tomlinson and John Cook.
Okay, thank you, Luann. Yeah, so I would have thought if it takes a little bit longer to do the consultation, to do it properly, or to do it with the extra elements that have been highlighted, that would be better than sticking to maybe any current timeline. So from my point of view, as a board member, I'd be assured if it came back a bit later, but had that robustness as part of it. The other thing I wanted to raise was it's in the monitoring, and so it's pages 143 to 145. Won't go through it in detail, but I'd have liked to have seen a bit more around that. I appreciate it might be sitting in there in terms of the various actions, but at the moment, if we're trying to increase satisfaction, which we should, and trying to get to 42%, if that's 42% of 3% of carers, because that's the number that we're in contact with, we really need, I would have thought, be looking at something specific about how many might we be in contact with through the period of this strategy, and therefore are the actions going to deliver that? So maybe I'd be looking for a bit more around the monitoring that would pick up some of that detail, and then echoing what was said at 3.7, if the previous provider didn't provide the data onto Quarriers, hopefully the new contract has it that data has to come back to the Health and Social Care Partnership, because that was just crazy if we didn't have access to basic data. So that was just some quick comments I'd like to see when it comes back. Thanks.
Thanks, John. That's helpful. I'll just go through all the hands that are up, and then Amy and Stuart, feel free to chip in if there's anything specific. But I'm taking that you're just absorbing the information and comments back at this stage. Okay, I'll go to John Cook next.
Actually, John Tomlinson has largely covered what I was going to ask. I had a specific around Appendix D in terms of the consultation going forward, and I was going to ask how do we maximise the number of people who are responding to that consultation in that timescale? But as I say, I agree with John T in that it's better to get it right and take a few more weeks than do it quickly and not get it right.
Thanks. Yeah, thanks, John. We'll maybe get a view on that near as we conclude this. So, John, your hand's still up. John Tomlinson, or is that no? Okay, we'll go to Christian next.
Thank you, Dan. Thank you very much for Alison. She talked a lot about what I was going to ask. I don't need an answer today, but can we take a note of, I've seen on 3.5, it's page 91, some of the numbers of the people we have identified as carer, and it says 7% of the Aberdeen population, and its average national average is 15%. I would love to have in the report what's the national average of estimation of carer we have not identified, and maybe an estimation as well in Aberdeen of all the carers we have not identified. I really want to have a better picture of what the gap exactly is, and particularly when we're coming in that extra crisis, I think there are a lot of carers who might have felt, because of stigma, not wanted to ask for support, will be desperate for support in the months to come. So if that could be added, a better quantification of what the gap is, it would be very helpful.
Thanks, Christian. And I think it ties in with John Tomlinson's question about the monitoring and how we'll monitor progress and what it is we're looking to do. So that's maybe an ask that can be more explicit in the draft, the final strategy when it comes to us. Shona, your hand's up.
Yes, actually, thank you, Luann. It was just on the back of what Christian said. Going forward, there's going to be more demand on the service. However, you know, say that the carer and the person looking after is with the same GP practice, and that person actually, the carer, becomes mentally unwell. We have an issue here that if they are wanting a service at Cornhill, then they have to have a different team, because it may be triggering events for that person if they suffer from PTSD, anxiety, depression, etc., etc. So that puts an extra pressure on the service because they cannot be with the same mental health team as the person they're looking after, who are the very trigger of why they've ended up psychiatrically unwell. So it's just to make that point as well. Thank you.
Thank you, Shona. I'm just looking to conclude this element now. There is the question of the timescale of when this comes back to the IJB, and I'd want to say to Stuart and Amy and all who've been around this that there's a lot of questions and comments back from the IJB today, but that's because we see this as such an important part of how we deliver the whole strategy for the partnership. It's all around our prevention work, it's early intervention, it's absolutely critical that we get this right. However, I'm also conscious that if we make it open-ended and we say there isn't, it's not coming back at the end of November, is there a risk that it slips and it doesn't happen? So I suppose I want us to do the consultation really well. What I'm also seeing in the report is that there will be a reference group that's set up to link in with wider carers, and that will be on an ongoing basis. So I suppose I'm putting it back to the team to have a view as to, is the 29th of November realistic for coming back with the final strategy? Would you want more time, or do you think that that gives enough time to do the consultation required? And that's my question back to the team.
Yeah, thank you, Luan. I suppose that's a very difficult question to answer. I'll maybe let Alison McLeod come in because I see Alison's got her hand up before I carry on.
Yeah.
Thanks, Stuart. Thanks, Luan. Yeah, I mean, I guess we could always say, when do we get to the point where we say that there has been sufficient consultation, and it's how we weigh that up with what's more important. Is it more important now to get as much consultation done as we can and feed all of that into the strategy, or do we get a strategy agreed, which we know perhaps still has gaps, and we as we're implementing that strategy, we work on plugging those gaps. And the consultation doesn't end when the strategy is approved. The consultation is an ongoing thing, and our action plan will be a living document that will be updated with the views of our carers. So just taking Alison's point on board, absolutely, no one is more frustrated than myself in terms of, not being able to get the strategy revised in 2021 when it was due to be, although we did do the desktop exercise to extend its life to 2022, but we didn't have the opportunity to do a full revision. So, I guess from my point of view, I think I would be reluctant to delay the bringing back the final strategy at the end of November, and I'd be keen that we stick to the timetable that the IJB approved, accepting that the consultation will be ongoing. But be interested to hear the views of the carers reps around about that timescale.
Yeah. So I'll open that up then to Alison Murray and then Shona as well.
Yes, just thinking, if it goes to November, when does it need to be into the IJB? A week before that? It's got to, it's intelligent consideration needs to be made of the responses and responses made to that. So we're talking a couple of weeks before that. So we're really talking, what, about 3 weeks of consultation from now? And certainly with for young carers, we've got or adult parent carers, we've got 2 weeks of school holidays. It's as I said, I've been torn before because I feel we just need to get it going, because we're so late already. It's we'll be getting on to almost 2 years late at this rate. And but on the other hand, I don't feel I could represent, I've never felt I could represent, I represent everybody, but I don't know everybody's, I can't give everybody's opinion at a meeting. And if we're actually to get carer input on the strategy, and this will be the first opportunity most carers have to input on the strategy. 3 weeks is not what you'd call an adequate timescale for that. So I don't know if that's very helpful, because I'm torn in both ways.
Thank you, Alison. I'll bring in Shona as well.
Yeah, I agree with Alison. I don't think it's enough time. And it's one of these things that people may speak or may not speak. I just had one query actually as to why the consultation hasn't just gone out as a public consultation, i.e. people have sight of it. Because I'm sure if that was the case, then a lot of people would come back with information if they could actually physically see the group we're consulting publicly, as they have done in previous occasions. So I just don't know the reason for that, but perhaps that's a suggestion. Thank you.
So, Shona, do you mean why the draft strategy in its entirety hasn't gone out? Is that what you mean?
Yeah, I mean, it's one of these things. It's like Alison said, you can't, as a carer rep, encompass everybody's opinions and their experiences. It's so vast that you wouldn't be able to, have a catchment of that. You wouldn't have a proper sight of that. I think the only way of actually doing it is to have this done publicly and perhaps have a stand, people coming past, even dropping things into a box, comments into a box about their experiences if they want a certain amount of anonymity, because people will. So I don't know, it's just a suggestion.
Yeah. Amy, I'll bring you in. I'm sure that you've got a lot of thoughts around this next phase.
Thank you, Luann. I just want to echo on Shona and Alison. And, we can't just do a consultation for the sake of doing it and bring a care strategy just for the sake of doing it. There has to be a lot of thought put into it, and everyone should be represented, particularly something like care, because there's so many elements to consider and so many different people who needs different kind of care needs, and the support for that as well, the carers need. There's so many elements. It's a complex it's a complex item we're discussing about. I don't think we're ready at all. And I think we need to do proper consultation where we actually get the right information that we're looking for in order to build the best possible care strategy that we need to put in place. This is not a tick box exercise, and we shouldn't treat it like a tick box exercise. This is the most fundamental and the most important aspect of building a care strategy, the consultation aspect of it, and we need to give real importance to it. Alison raised a lot of important issues. That clearly shows that there needs to be a lot of work done in terms of consultation and hearing from a lot of people that actually contribute to this care strategy. At the end of the day, they are the ones who need this strategy should work for, and it should not be looked as a tick box exercise from our end. We need to make sure that they're heard and this strategy is there to serve them. That's what I want to emphasize. Thank you.
Thank you, Dina. And yeah, none of us absolutely want this to be a tick box exercise. It's so critical to the success of the partnership. I'll bring in Amy now, and then John Tomlinson.
Yeah, thank you, Luann. So I would wish to sort of draw attention to the engagement paper and our briefing there, and certainly there has been wider work around engagement on the strategy, and what my predecessor said to those people that had been involved in that was that we would come back with something more concrete with our intentions, and certainly that would be the next step in terms of taking the draft strategy out to members of the public to really sort of dig into the detail. So certainly that's the aim of the consultation, and we do have a schedule of consultation events. We have one planned with the learning disability parents tomorrow night, and a series of others in terms of online and in person, and also looking to do specific work with certain carer groups, for instance, our young carers within schools, which obviously wouldn't be a public forum, but requires a different kind of approach. So we have plans in place, and I would also really want to stress the input from young carers through the Bernardo's groups in terms of this consultation. They've been really quite engaged in doing it, and I would want to kind of recognise their input.
Thank you, Amy. So I'm going to draw this to a close quite soon. So John, you've got your hand up, and then Alison, and then we'll consider the recommendations at that point. John.
Yeah, I'm just thinking, listening to Alison being torn between we need it in place, but we need, you know, more robust consultation. I'm just wondering, could the first year of the strategy not have an action to, I think Alison was probably alluding to this in her input, to actually do that work? Because I'm just even anxious that even in 3 months, if you gave yourself, you might not be able to bottom out what Alison's and Shona have been talking about. So it sounds like the strategy could have in the first year to come back, having done that work robustly and revising the strategy at that point after year 1 as required. Would that not enable us to go forward with both these things?
Seeing people nod. I'll bring in Alison Murray first and then go back to Amy.
Yeah, that should be done. I just, it's sort of, I can see that, yes, you can say that's a good idea, but I sort of, that should always be in place. That should have been done in, oh, obviously that should have been done in 2020, and we know what happened in 2020. And but yes, but so I again feel quite mixed, because then we're basically saying this is another temporary carer strategy while we draw up appropriate carer strategy, which is sort of where we were last year. And it sort of, because yes, that's what we said last year. We'll change the dates and everything, and then we'll do a proper consultation. And so I think if that's going to happen, I would rather this had a proper consultation and came in January rather than do that, because I feel otherwise we've again taken the deadline away and it becomes another open-ended thing, a bit like where we were last year. I was just, what I had my hand up for was actually the in-person events that were being proposed. They are all people who are already engaging with services, and presumably to some success if they're going to come back again. We need to advertise widely to get people to come to events where there are people who are not engaging in services, because they're the people whose needs we're definitely not meeting, because we're not even talking to them. So I think that's been part of the problem, is that we sort of got some we can access easy through Barnardo's or young carer groups or adult carer groups, but they're the ones who are already accessing services, and it's the people who aren't accessing services and the people who are carers but don't know they're carers and won't identify as carers, but they're still carers and still have the rights of carers that we need to contact. Thank you.
Thank you, Alison.
Yeah, can I come back on that point, please?
Sandra, yes.
Yeah, thanks. So really conscious of it feels like we're in a bit of a circular conversation with here. I think that it's been well acknowledged about the issues that we had in 2021, and I absolutely understand your frustrations, Alison, as a carer and as representative on the board. So I fully acknowledge that. What I would say is that if we do look at the engagement exercise that has been undertaken, there has been engagement that's been undertaken and they're well represented. There are groups that are represented on there, so fully appreciate that not everybody's voices may well have been heard, but there are not it's not this is the people around the table and that's how that's went. You would have expected wider consultation, which hasn't done. I absolutely take on board the bit about January and what the consultation, but the bit that's confusing me is, and I think as somebody said, what we need to be absolutely clear on is, what I am not clear on is what is the expectation. So we can go out to advertise, we can ask people to contribute, we can go out to hear. There's a reason sometimes that people's voices are not heard. So we're working with our wider partners, we're working with those agencies, we're working with our young carers, we're working with ACVO. I think Maggie will be on the call, I'm sure she'll be supportive of there. So I suppose at what point do we have an understanding that we have consulted enough? And I think I'm wondering whether we do need to consider, yeah, absolutely agree if we come back in January and we can do that and extend the process out. But I think there'll have to be an understanding and agreement about what that consultation is then going to look like, because otherwise it's just exactly as what feels to be going round and round is is when will the consultation be enough? Totally agree with what's been said by IGB members, that there are different voices out there, but there has been a wide range of groups that have been involved in this so far and continue to be. So if we do that for January, is there specifics or anything specific that we could come back with, so that when the team comes back and the work and the wider carer strategy support group come back, that they're confident that they've met the expectations of the IJB? Because what would be difficult is to then extend this period to go back out again and then come back and us rehearse this, you know, people feeling that we've not consulted enough again. So just really looking for the well-rehearsed narrative that we've got about consultation, but what exactly is there, and maybe that's for taking offline, Chair, so that we can get some explicit understanding about that for the team that are around us.
I think I'm getting pretty close now to knowing what we need to do from all this discussion, but I know I've said that we would close this down, but there's 2 hands up. We'll take those last 2, and then I'm going to suggest a way forward for us all. So Shona and then Dina.
Thanks, Luann. I think when Amy said about the public consultation, I don't mean people in a hall. What I mean is having strategic booths for people to come up, perhaps put, you know, write something, put it in a box. They can say what their experiences are, but you have to have sight of the carers, and the carers are going to be at places like the hospitals or units, because although you're engaging with certain groups, there's certain groups that you're not engaging with, such as Bipolar Aberdeen. There's a lot of carers that are actually signing up to that. And it's really difficult because they will have then their family member there. So they're talking about things that's triggering for the family. And she hasn't got contact with anybody that can help her, apart from, say, something like Bipolar Aberdeen. So why are these people not being engaged with? But it's just to get a wide sweep. I wasn't talking about a hall meeting. I was talking about signposting and being seen, so that people can actually give you feedback properly. Thanks.
Thank you, Shona. I think, yeah, there's lots of ways to do the consultation elements. So Dina, and then we're going to draw this to a close.
Thank you, Luann. I'm just going to put my public health research consultant hat on here just for a little bit. So I think what we're trying to find is if we are hearing all the voices. I think a number one thing to do that is to actually recognize the carer groups that we need to speak to in our consultation. After we have spoken to them, I think what we need to do, something like a care strategy, needs to have continuous consultation, continuous improvement and implementation and evaluation. So once we've done that initial part of the consultation, I think what we need to do is look into continuous consultation and improvement processes going from there onwards. That's my suggestion. Thanks.
Thank you, Dina. It's going where my mind is going, so that's really helpful. Amy, final point, and then I'm going to make a suggestion as to what we do now.
Yeah, thank you. And I welcome all those points. It was just by way of reassurance around advertising, and certainly we've been speaking with Graham Lauder as our communications lead about how we get the messaging out, and would be really keen that members are proactive in getting that messaging out as well when we're ready to do so.
Thank you, Amy. So from what I've heard, I think looking at the recommendations as they are, we can endorse the draft strategy and action plan with the feedback and comments that people have made, endorse the engagement overview and consultation timeline, although that's maybe the bit that we can change about the timeline. Note there will be a period of public consultation, and instruct the Chief Officer to present the IJB final version of the strategy. I think it should come for approval early 2023. And I think we should look to take offline the specifics that we want to cover in this consultation exercise. Who are the groups that we need to be absolutely sure we've spoken to, so that when it comes to the IJB in January, there is no doubt that we've spoken to the right groups. So I think that's an offline discussion with our carer reps and the team about, you know, who are all the groups we need to have consulted with to make this a final strategy. But in addition to that, in our year one plan, we need to be very specific about how we are engaging with people on an ongoing basis, how we are seeking feedback to improve the service, and how we're monitoring our impact. So all the stuff that's been talked about earlier. So if people are content, we could amend the recommendations then to extend the consultation period to the end of the year, seek to have the final strategy coming back in January. But what we're looking for prior to them is to make sure, to be able to be assured that all the right groups of carers have been considered and consulted with, and that we look at the detail of year one to ensure that we're doing that ongoing engagement work and considering impact and improvement throughout the strategy. So we're listening to people, but we're also getting on with stuff early next year, which is, I think, where we all want to get to. Are we happy with that as an approach from folk? And yeah, I'm seeing people nodding. Yeah, thumbs up. Okay. I hope that's clear. What I'm suggesting. So we're not delaying this indefinitely. We're saying end of the year. That's the consultation period finished. We'll take a report to the IJB early in the new year, and we'll look for a year one plan that's very detailed around that engagement and improvement work. Okay. Thank you very much, everyone, for contributing to that. I think that was a really important discussion for us to have. There's nothing more critical to our success as a partnership than how we're considering our carers, because they are a hidden army of people out there that are supporting our most vulnerable people on a daily basis. So really important. And I'm not even going to apologise for running over, because I just feel that we needed to do that. However, we have run over. We've got 2 items left. My suggestion would be that we do these items and then we have a half-hour break before our seminar this afternoon. I hope that's okay for folks. So we'll just start our half-hour from whenever we finish these 2 elements. So we've got item 8.2, which is complex care market position statement. I see Jenny has popped up on the screen. Jenny, do you want to introduce yourself and this paper?
Hi, Luann. I'll introduce it, and then Jenny will highlight 1 or 2 key points, and I'll try and be brief. And then between us, we'll take any questions. Sorry to change the batting order a wee bit. The full complex care market position statement is quite long and detailed, and dare I say it, probably a wee bit complicated. But page 181, the appendix A, is a very good summary, and it gets it in a nutshell down to 2 pages. So it's the best way to get up to speed with it. Basically, it sets out how we're going to plan and provide complex care over the next 5 years. It gives an indication of the needs and requirements that are going to be increasing over that spell, and also how we're going to try and address the not insignificant challenges around about getting new buildings or suitable environments, redevelopments or whatever, and the costs that go with that. It is very detailed, but it is information we wanted to share with our providers and partners, and it is also the clarity that some providers have asked us to provide. So it's in response to that request as well, and it's also how we're going to be addressing the National Coming Home Report, which board members will be familiar with, around providing services for people with complex needs in their own communities. Quite often for us, that's the out-of-area placement option is the only option, so we want to reduce the requirement on that. And we also want to get some folk with complex care that are currently out of area back to their own communities. So Jenny will probably want to highlight 1 or 2 things just before we take any questions.
So I'm Jenny Ray, I'm Programme Manager within the Strategy and Transformation team. So as Kevin's highlighted, the market position statement, the audience for that statement is providers of care and support and accommodation for people with complex care needs. So the document is quite robust in terms of level of information, and the summary really will give members the key points to consider. And as Kevin's mentioned, it's about adhering to that national vision of bringing people who are in out-of-area placements home, and their home being in Aberdeen. Also supporting people who are in hospital just now and require specific types of services and specific environments to live successfully in their local communities, and preventing people, younger people, but also people who are already in existing services from needing to access either hospital services or those out of area placements. So we really do have a lack of service provision just now, and this is about increasing what we have to meet our current needs, but also anticipating that those needs are going to grow. The numbers of people will grow over time, and partly that's because the environments that people live in just now are not suitable. So people often can challenge those environments in terms of their behaviour, and the support structures that are around people need the environment to support them. So we really view the support and the accommodation going hand in hand in terms of delivering a really safe and suitable environment for people, and also providing them opportunities really to live a good quality of life, being tied into local services, local amenities, and really being part of the local community. So we have engaged with a range of providers who we already contract with for complex care services, and our hope is that we can continue to engage with both those providers and people who will provide accommodation settings for people with complex care over the lifespan of the market position statement. There's a range of actions which we'll look to further develop as we move forward, and a lot of those are already underway, including some work with Scottish Government specifically on detailing more around our need and tying into the national requirements around a dynamic support register and national support panel. And definitely happy to take any questions that people may have.
Thank you, Jenny and Kevin, for that introduction. I'll open that up for anyone who wants to ask questions. My sense of this is that this is the beginning of a long process of improvement that we're on, and that starts with identifying what the problem is that needs addressed. So I think that's my simple understanding of what we're aiming to do here. I'll bring in John Cook first, and Christian first, and then John Cook.
Thank you very much, and it's a very good report, and it's very good aims, and a lot of work have been to it. I'm just worrying about some of the recommendations and some of the aim we are putting on housing and environment. When we want to support people to live in their own homely environments, when we have a lack of facilities already ourselves, and will maybe struggle to find somebody who will be able to, particularly with the energy bills. I can't see how we can get people with mental health in areas where we used to be able to do it, how we can do it now. I know there is some recommendation to it shouldn't affect the financial. We've got to make sure that it's financially secure. But I don't. I think it's a very good aim, but I don't know if there is something in there. Are we going to have to maybe defer the implementation of this housing recommendation, just waiting for the situation to get a lot better, because it seems to be an impossible aim in current circumstances.
Thanks, Christian. So is your question just about how deliverable what is being proposed is, or what is it you're looking for from Kevin and Jenny?
Yeah, absolutely. On page 194 is there, and maybe the time it was written, that was general aims in general circumstances. But with the circumstances we have just now, I just want to know if there is an option B as opposed to the best option A. I know that it says only that third sector organization and others could help, but I know, having spoken to a lot of third sector organizations the last few months, that housing, putting single people in housing seems to be absolutely impossible. Energy companies wouldn't take them on.
Thank you, Christian. Kevin.
Yeah, I mean, Councillor Allard's absolutely spot on. It is very challenging economic circumstances, even without what's happened in the last couple of months about cost of living. I guess the situation is the people with complex care needs are either out of area or they're going to end up in inappropriate buildings in premises, and the environment's absolutely critical. So we can't put scope with their needs, and it's very difficult. It's very individual and very specific, but they cannot live in the properties that most folk in society can live in. And the policy is that we care for these folk as near their homes as possible. I think we just have to accept that it's a very challenging economic sort of environment. I guess on the plus side, as the chairs kind of alluded, it is a longer term plan, so we're not going to be opening or having a facility in 6 months' time. I mean, we'd love to have that because it'd be great for the people that need the service provision. So I guess the cost of living situation and cost of energy and stuff will hopefully not be so critical as it is just now. Bottom line is we've got to provide services and an environment for these folk to be cared for in supported living environments, and we need it to be as near the communities and their families and friends as possible. So I guess we kind of shut the challenge.
Thanks, Kevin. Jenny, did you want to come back on that point as well?
Yeah, so it was just to maybe cover off just a couple of things that might help. So as Kevin's kind of highlighted, the environmental specifications, if you like, that people with complex care needs have are significantly different to what we would term as general needs housing. So housing that perhaps you or I would access in the local community. And because it's so specific, we've done a lot of work to be able to demonstrate the reasoning for that. You know, we have had you know, a lot of challenge around, well, why might it be that potentially, for instance, larger room sizes are required, or particular considerations around you know, the actual buildings, why are those things needed? So we have had involvement from learning disability specialist occupational therapists around this, who are specialists in those areas of key environmental factors that are going to help people, and it's all around the environment aiding the support that's provided to people. So I guess if we view the environment as either a supportive or non-supportive aspect to someone, so you could have the best care that's going to meet everyone's need, but if the environment is not supportive or conducive to that care actually having an impact for the person, it can be really detrimental. So the two kind of go hand in hand and complement one another. And there is an aim from Scottish Government that by 2024, the majority of people essentially who are in inappropriate placements out of area or locally, and also delayed in hospital, that those people are accommodated as best as possible in their local area. Now that does pose a challenge to meet those timelines, but we are working towards those timelines with colleagues both internally within the partnership, within Aberdeen City Council, and then broader working with other local areas to learn from what's really worked well from them, what challenges they've had, so that we can try to work out what the best course of action is. But no one's denying this is a really tricky problem. It's a small number of people in the grand scheme of things. You know, you can almost count them on your fingers and toes, and the numbers of people that we're speaking about, but they have a significant cost implication to the partnership. They have a significant kind of detriment to their quality of life, which is probably the most important thing, and they deserve to live locally where possible in safe and secure services. So it's aspirational, and I think that's the aim with having the 5-year market position statement, that we can begin to work with partners and continue the good work that we've been doing to build those things up, and aspects like cost of living, utility costs, etc., are being, you know, are affecting the whole of the country. So we'll be able to learn and work with our partners around those things. And because often we're looking at new build accommodation or significant refurbishment of accommodation, things that are going to be more cost effective for, say, people's energy bills can be built into those factors as well. So hopefully people are in cost efficient, if you like, homes that are going to be fit for the future, and those are going to be homes that hopefully we can access for a long time, whether that's for individuals or for this category of individual, if you like.
Thanks.
Thank you very much. You know, but it's very helpful, Jenny and Kevin. You said 2024. That's not going to be that long time away. So please come back to us if you feel at one point there is something which is not achievable in the timeline which is there.
Thank you. So final question from John Cook, and then I'm going to go to our recommendations for this so that we can move on. John.
It wasn't a question, it was just a comment. In terms of the pages 181, 182 of the pack, the kind of 2-page simple summary. I think in terms of when you're writing papers for a board where a number of people may not necessarily be completely au fait with all the complexities of what actually is a complicated and complex issue, that's an example of good practice, because it was kind of, having read those 2 pages, it was right, I kind of got the rest of it. So just wanted to commend that and say to everybody else, that's an example of good practice when we're writing about complex issues. That was it.
Thanks, John. Hopefully you appreciate that feedback, Jenny. I know that was an extra ask of you to do that, but I think it's been really helpful and something we can look for in other papers. So I'm going to move us to the recommendations, acknowledging the conversation we've had. So we're agreeing to approve the complex care market position statement. Recommendations are on page 175. Note the progress that progress on delivery of the market position statement will be reported annually to the IJB. Note that finance-specific updates will be reported annually through the RAP committee. Instruct the Chief Officer to explore with partners new building and property redevelopment opportunities, and instruct the Chief Officer to continue to work jointly with Chief Officer for Children and Family Services to ensure planning and provision of complex care for young people moving into adulthood. We're happy with those recommendations. Yeah, and we look forward to having the reports in a year's time coming back. So thank you, Kevin. Thank you, Jenny, for bringing this to us and for all the work that you're doing to take this forward. A really important area. Thank you. So that moves us on then to our final item for today, which is the Rubislaw Park end of life care beds. Now, what we're being asked to do today is note the evaluation presented and instruct the Chief Officer to initiate a business case on the end-of-life care beds and report this back to the IJB in November. So I'm really asking IJB members today if they have any burning questions that would mean that we wouldn't go and agree these recommendations rather than go through it in our usual way. But I want to make sure everybody has an opportunity. If there is something you're sitting with that you're uncomfortable about, whatever in the paper, please raise that now. That's relevant to these recommendations. So I'll give members, and I'm sorry, James and Michelle, I see you're here, but I'm wondering if there's just a slightly quicker way to do this item.
That's totally fine, Chair. Thank you very much.
We will be receiving the report coming back in November. Do people have any comments or anything on this paper, or are we content to approve today? Okay, good. So the quickest paper ever probably to go up through the IJB. James and Michelle, thank you for being here to answer questions. We're going to note the evaluation and we're going to instruct the Chief Officer to come back with a business case on end-of-life care beds and report this to the 29th November IJB. Okay, good. We're all happy with that. Thank you. So that brings us almost to the end of our meeting today. We've got our next meeting on Tuesday, the 29th of November at 10 o'clock, but we have our seminar this afternoon. I'm suggesting that we start that now at 1:30 to give us just over half hour for a break. Sandra Fraser, I hope that's okay for the colleagues who are organising and presenting at that seminar, but I do think we all need just to come away from our screens for half an hour. We'll just use the same link, even though it means us to go into it now. Emma, we'll just keep the link and join at 1:30. Yeah.
There's a new link actually.
There's a new link. Okay.
That has been issued, and I will amend the appointment time to start at 1:30 instead.
Okay. Great. Well, I'll just close by saying thanks everyone for contributions and discussions. Always lively and always good to have the diverse views we have around our IJB table. So thanks everyone for contributions, and thanks to the team for all the papers that were presented to us today. And I'll see you all at 1:30. Okay. Thanks just now. Bye.
Thanks,
Chair.
Thank you.